Good morning, madam.
Good morning.
Satish here, madam.
Okay, good
Can
morning.
we start, madam?
Yeah, start.
Ubaidullah, sir. Good morning. Myself, Satish Kumar, Assistant Professor, CL Bain Mehta College of Pharmacy. So I request all the participants to mute mute yourself before starting the session. So once again, I'm repeating. I request all the participants to mute yourself. So let us start the session with a great quote by Dr. APJ Abdul Kalam. Learning gives creativity. Creativity leads to thinking. Thinking provides knowledge. Knowledge makes you great. So here, it gives me immense pleasure to extend to you a very warm welcome on behalf of the CL Bain Mehta College of Pharmacy, where we clubbed all of us for the International Webinar Series 4, Day 2, on the theme Advancing Scientific Knowledge in Times of Pandemic. So yesterday's session was very informative and interactive with lot number of participants. Hope so. Today's session will also
meeting வரலாம் go to meeting sound இல்ல go to meeting sound வரல
It's another confirmation saying that, claiming that our gold nanoparticles were super anti-biofilm in its activity. So next, whether these nanoparticles are toxic or not. As like you guys doing toxicological analysis using mice or rat, we in our previous lab in Yangon University, we used to have C. elegans as an animal model. So this is a worm. We can use this worm as a model for analyzing the toxicity. So we use this picture shows the uh, gold nanoparticles presence. So gold nanoparticles are not only used as a photothermal agent, but also they are used as a contrast agents. Like you can see, they can these worms can eat the gold nanoparticles, and you can see
This conference will now be recorded.
it the gold nanoparticles kill the pathogens and it prolongs the life of this nematode. And this video shows the excretion of the gold nanoparticles, which means that these gold nanoparticles, although they are containing cinnamolate, but they are friendly to the nematode C. elegans, and they survived after the treatment of the biofilm. And further, these cinnamolate nanoparticles were tested against fungi. So fungi are bigger organisms than bacteria. And they are so dangerous than bacteria. So we tested our nanoparticle against fungi, and these images and these data shows how the fungi biofilm was retarded in the presence of cinnamolate gold nanoparticles with the confocal microscopy and the microscopic optical microscopy images. So this is the end of my first part. I'm moving on to the next part, going to discuss about the real life applications of sustainable nanomaterials. So what are sustainable nanomaterials? Sustainable nanomaterials are nothing but nanoparticles obtained from nature. So usually we used to synthesize nanoparticles from the laboratories, but they are kind of toxic to the humans and toxic pollute the environment. So we want to I want to move my research area towards sustainable energy, sustainable nanomaterials. So I started working on cellulose nanocrystals in the University of Waterloo, where I am currently working in. So cellulose nanocrystals are
This conference will now be recorded.
extract the cellulose nanoparticles by acid hydrolysis. Initially, it will the primary and second wall of the plant cells were destroyed, and it will separate the lignin and hemicellulose. And the cellulose fibrils were again hydrolyzed using sulfuric acid or acetic acid, and the microfibrils were obtained. Further microfibrils were hydrolyzed by acids to get the cellulose nanocrystals. So this is the typical steps involved how to obtain the uh, nanoparticle from the plant sources. So this process involves very less chemicals and very less energy and time and money, etc. That's why sustainable nanoparticles and nanomaterials are so important in our present life. So what are the properties of sustainable nanomaterials, especially cellulose nanocrystals? So cellulose nanocrystals has
This conference will now be recorded.
so three groups on its surface. And what are the types of modification you're doing? You can make cationic charge on the nanoparticle or anionic charge. So what are the physical properties? They are morphologically unique, and they're crystalline in nature, and their specific surface area is better than other metal nanoparticles, and they are so strong and better mechanical properties. And these are highly dispersible in water, and they have a unique character called biorefringence. Means when you are increasing the concentration according to the different concentration of the cellulose nanocrystal, it will reflect the light, produce different color to the human eyes. So what are the applications have been done using the cellulose nanocrystals? As like other metal nanoparticles, these sustainable nanomaterials also being used in different parts of day-to-day life, as shown in this picture, starting from nano and microfibers and e-skin, photovoltaics, sensors, biomembrane, uh, smart paper, anti-counterfeiting, decorating, anti-reflective, and so on. So there are multiple examples every day. It's emerging using these sustainable nanomaterials. So where the CNC is. So according to the data from the Science Direct, there are the papers published in Science Direct are increasing year by year. So up to 2017, about 1,000 papers are being published every year. So when we look deeper about what are the publications and patents applied together using cellulose nanocrystals, there is an interesting fact. More patents were filed or approved than publications. It means that the cellulose nanocrystals are being applied in the real life applications than other metal nanoparticles. This is an interesting fact that made us to work more towards these sustainable nanomaterials. So again, I'm going to talk deep about what our cellulose nanocrystals are. So as I shown before, there are amorphous regions and crystalline regions from the microfibrils. This will be hydrolyzed using sulfuric acid to get the crystalline region as a cellulose nanocrystals. So these are the typical structure of cellulose nanocrystals, having 1,4 beta glycosidic linkage, and they are crystalline, rigid in nature, stronger than steel, some reports say, and they have good large surface area with plenty of surface hydroxyl groups, which can be easily modified with the other surfaces, and it has high tensile strength and less to moreover no toxicity. So since they are from plant sources, so they don't have much toxicity. So what we are working on using these cellulose nanocrystals, as we know, the oral diseases are the most common non-communicable disease throughout the world, and every year around 3.5 million people are affected with these dental infections or dental problems. So we want to provide a better solution. Although there are many products available in the market using silicon nanoparticles, zinc oxide nanoparticle, sodium alginate, toothpaste, and dentistry, these are the different dental materials are being used without without using the nanotechnology, but they do have some are many disadvantages when it comes to polymer resins, matrices, and fillers. They have less stable time, less stability in case of longer time, and they can cause secondary caries, and polymers will shrink after long time of exposure, and they cannot withstand for the roughness created in the oral cavity. Alternatively, amalgam was the traditional kind of chemical being used for dental things. It does has strong longevity. It has antimicrobial properties because of mercury and silver and copper. But the most important disadvantage of amalgam is it produces neurotoxicity, and it causes a dark color on your white teeth. So these days, most of the dentists, they are not using amalgam. So these are the disadvantages or limitations of the available products. So we want to bring a solution. So we are these days we are developing cellulose nanocrystal based uh, composites to answer these problems. So this can be attached to, this is the typical cartoon about the cellulose nanocrystal and its surface modifications. These blue colors are showing the polymer structures, and this plus charge is the quaternary ammonium group, and these pink color dots are nanoparticles, either gold or silver nanoparticles, and the green color cartoons are plant extracts or cinnamaldehyde like plant extracts. So these material could be used in different purposes, different applications, starting from antimicrobial, imaging, cosmetics, thermoresponsive drug delivery, photothermal therapy, gene delivery, and produce coating. So moving further, I'm going to talk about what's the importance of sustainable nanomaterials in skincare products. So as you all know, every day we are using a lot of cosmetics in our day-to-day life, but there is a big question mark whether all these cosmetic products are safe to use. Since there is no strict regulations on cosmetics like drugs, like FDA, like regulatory bodies, so the cosmetic industry can manipulate many chemicals or toxic or harmful substances in their formulation. So this is when we were started researching more about this, we got so shocked, really. So that's why we want to bring a solution for this problem. So, okay, moving forward, what is skincare? So skincare includes various cosmetic products designed to appear on skin, to protect skin, to regenerate skin, to maintain skin's texture. So there are different a number of skincare products available. For example, face cream, hand cream, sheet masks, and sun care. So who is the most who are using most skin products in this world. So as without a surprise, United States is in number one. They are using about 19 million US dollar per year in the name of cosmetics. Next, Japan, $17,000. China comes third with $15,000. Surprisingly, India comes in fourth place using $8,000 million revenue of cosmetics being utilized in India. And South Korea comes fourth, and Canada is in number 16th place. Why Canada is in number 16th place? Canadian people want to live with nature, like natural beauty. They don't use much cosmetics, so that's why Canada is in still using very less kind of cosmetics. And compared to the Indian population, Canadian population is so small, so we cannot compare in that way. So moving forward, what are the impacts of sunscreen? So I'm moving it very briefly because there are a lot of things I can discuss, but due to the shortage of time, I cannot discuss most things. Sorry for that. So moving forward, sunscreen is an example of skincare product. So what sunscreens do on your skin? There are three types of materials being used in sunscreens, starting from chemical UV filter, mineral UV filter, nanoparticle, and coarse particle, cream or lotion, etc. So what chemical UV filter does, it absorbs the UV rays and it will destroy the UV rays on the skin surface. In the case of nanoparticles, they reflect the UV rays to protect the skin from the UV absorption. But there is a big question mark. The chemical fillers being used in sunscreens are called oxybenzone, for example. They can prevent the UV rays range of 280 nanometer to 400 nanometer. They do very well. They can block the UV rays very well. But there are different stories about toxicity. They are producing so much hormonal imbalance. So that's why the chemical still it's so dangerous. But since it's approved by FDA, many cosmetic industries still they are using these chemical filters. Then moving on to nanoparticles, yes, nanoparticles are being used, especially zinc oxide and titanium dioxide nanoparticles. As I told before, that's why most of your sunscreen creams are white in color because of these nanoparticles. But there is a big problem. When you are washing off your sunscreen, it will go to the drain. Since our drainage facilities cannot separate nanoparticles, and it will directly go to the water stream, and it will cause so much damage to the aquatic environment. In case of sea oceans, they do the bleaching of coral reefs. So coral reefs are very vital part of healthy oceans. So these nanoparticles are bleaching them and killing the coral reefs and destroying the aquatic environment. So that's why these nanoparticles are also being banned these days in many beaches, especially in USA and some parts of Philippines. But still, since there is no much option, still these nanoparticles are also being used in UV protection sunscreens. So these are the problems arise using the chemical or metallic nanoparticles. So we want to bring up a solution. So these days we are working on using natural ingredients. As I told before, uh, we can use natural plant extracts like cinnamaldehyde. We can instead of chemical filters, we can use natural ingredients to prevent the UV rays. So in India, especially, we have a lot of plant ingredients. So that's why our ancient people were live with the nature. That's why they were protected from these harmful substances or harmful things, not these days. So that's why the Western countries are nowadays focusing on more sustainable materials or more natural resources. So that's why we are working on to replace all these harmful substances. How can we use the technique from the nature to prevent our skins from the UV radiation, and additionally, how can we protect the other environment from the pollutions. So there we are developing more and more things these days. So yeah, we are using plant extracts or plant materials to develop the sunscreens. So moving forward, I'm going to talk about probiotic encapsulation using the sustainable nanoparticles. So probiotics, again, they are also important for our health. You may not heard about probiotics. It's coming into biotechnology anyhow. So probiotics are nothing but bacteria. They are non-pathogenic living organisms. They provide a more health benefit to the host, like to the human beings especially, and they reduce the harmful effects like diarrhea and constipation, especially in the GIT. There are different types of probiotics are available, for example, lactobacillus and bifidobacterium strains, and you can see the you can in daily life probiotics are available in the forms of yogurt, cheese, kimchi, bread, beer, and etc. So what probiotic does? So probiotics compete with the nutrient. There is a competition for the nutrients in our body, like between pathogen and probiotics, and definitely probiotics need to take the pathogen and produce the and prevent the infection from the pathogen bacteria. So probiotics are especially kind of important factor in our health. Why? Our intestine or gastrointestinal tract is called secondary brain. Once your secondary brain is damaged, like malfunctioning, your entire body will collapse. So that's why the probiotic, that's the indirect meaning of how to keep your probiotics in a healthy way. So once your probiotic system in your stomach get destroyed, you will get develop a lot of diseases. Eventually, you may die. So maintaining a good stomach or good GIT is the vital part. There, the probiotic plays a major role. That's why we say the gut feeling usually. So moving forward, yeah, so these are the typical diagram how the probiotics are being formulated these days. So as shown in this cartoon, this is the probiotic bacteria, and this is the coating material called microencapsulation system and prebiotics. Prebiotics are nothing but like nutrients, like fibers being eaten by the probiotics to keep them healthier, to keep them multiply using these nutrients. So these are the typical different coating layer coated probiotic capsule are being marketed in these days. So yeah, probiotic encapsulation using sustainable nanomaterial is our theme, because there are not much products are available, because as we seen from this cartoon, the probiotics can enter into the GIT and it will proliferate in the intestine. So as you know, our GIT has digestive system with different pHs. So probiotics should stable in the different pHs, especially in stomach, where there is a high acidity, the probiotics get killed easily. Most of the probiotic formulations or probiotic products available in the market, they that's why they are putting more number of live bacteria, more number of bacteria in their formulation. They can pass through the stomach, although they may got killed, but some of them may pass through the stomach, passing the bile salts, competing with the bile salts and bile acid, they can proliferate in the intestine. But most of the probiotic formulations failed at this step. They could not produce the intended purpose. So here we found that's the big problem. So we want to provide a solution by coating the probiotic bacteria with our sustainable nanomaterials. That way we can give better gut health, gut bacteria, healthy gut bacteria, and we can say that's the functionalized into food form. Either we can deliver it in the form of a yogurt, honey, or some salad, something like that. And the acid tolerance is the most important part. So we have to formulate our probiotic capsule which tolerate the acidity. So these are the different techniques used by different different formulations, different companies which are available in the market. So the probiotics can be coated with 5 microencapsulation technology layers. So these different, each layer shows each functionality, but our aim is to coat with one layer and prevent the probiotic to uh, provide better activity. So this diagram shows how the probiotics are survived at different conditions, like at different acid conditions at pH 2 and at which under bile salts at 5 hours. So after coating with different materials, these probiotics survived a lot. So means they will maintain good health in the intestine. But these techniques are more expensive and they again use so much chemical processes. So we want to bring a solution for these things. So that's why we are using sustainable nanomaterials. Although we developed initial methods, but we are still working on it. So these are the applications of sustainable nanomaterials in our day-to-day life, starting from dental applications, cosmetics, and probiotic encapsulation. We are very excited to work in these projects with different people, with different graduate students and undergraduate students, and we are working on making our sustainable nanomaterials to maintain good health, not only for humans but also for the other outer environment also. So this is the end of the six part 2. Moving on to the part 3. So I'm going to talk about graduate student life and a researcher's life in abroad than India. So why I chose this part and why I want to share these informations. So whatever the informations you can get from the Google or online sources may not be suitable to you or they may mislead you. So I'm not 100%. I cannot provide 100% things here, but I can cover as much as what I experience in my personal life. So as a pharmacist, as a pharmacy student, we were taught very well in India. We are very strong in basics, especially our pharmaceutical sciences, especially from Dr. MJ University. The colleges are doing pretty well. So those things helped me a lot, even though I changed my major after MPharm pharmaceutical analysis. I changed it into biomedical engineering in my PhD. But whatever I learned in my 6 or 7 years pharmacy studies, starting from diploma to MPharm, those helped me a lot, are still helping me a lot till date. So while choosing your next career from pharmacy, from your undergrad, master, or PharmD, you choose your things very wisely. So the upcoming slides will help you a lot. If you have any doubts or any questions, you can raise it here. Feel free to ask, or you can email me at any time. By yeah. So graduate study. So graduate study basically called undergraduate, postgraduate, and PhD studies in foreign countries. So yeah, while if you want to enter into graduate studies, you have to follow these steps. So fix your specialization first, which area you want to focus on, prepare yourself, get ready because the world is so competitive. So do basic research on the field of study which you want to go and prepare a brief proposal before approaching to the professors or universities and choose the best or better universities and approach professors and departments directly and do not rely on anyone like than your very close or very good friends or very good seniors. You no need to rely on anyone because every information, you are educated, you are graduated from pharmacy, so you know things very well. So you can check it from online, you can read, sit and read, you can prepare your materials, you can apply by your own. So do not somebody will say, hey, I can help you get this person and all, but I should say strongly, please avoid those kind of people. Try to be your own. If something happened, you will be responsible at the end. You don't need to blame the other person. So in the other part, what's the overview of researchers' lives? Researchers' life, sorry. So research life in foreign or abroad is highly competitive. Unfortunately, I didn't experience much research life in my pharmacy studies in back in India, so I didn't know much. Unfortunately, our system, Indian education system, is different. Technical universities like Anna University, Bharatiya University is entirely different from our professional universities like MJ University. So as a professional students, we are entirely doing different things. So that's why the different comes. So those Anna University, Bharatiya University, those kind of people, they are got trained by their seniors, so they are very well exposed to research part. But in the case of pharmacy, although we are doing research on every day, like preparing a cream or doing a titration, we are doing research from our day one in B pharmacy or diploma or M pharmacy, but we are not converting that into the high level. That's the big problem. I feel I I feel that's the problem happening in India. So we are also already a researchers, but we are not converting that into a valid research output. That's the problem. Although I did my project in BPharm with three of my other friends and did individual project in MPharm. Luckily, I was able to publish my MPharm thesis into a paper. But in BPharm, although our staff members were told to do that, but we were not focused that much. Although because our uh, curriculum was so much, so we were forced or we were asked to focus on our curriculum to get good grades. So that's the kind of a little problem in our pharmacy life than other universities in India. So again, coming back, yes, it's highly competitive. Getting a graduate, the researcher position as a PhD student or master student in a foreign country, you need to work very smart than hard work. Yes, you need to manage things very smartly. Your hard work does help you, but it will not help all the time. So you have to be smart in all the ways, like maintaining your things, planning your things, arranging your things, something like that. And you will be given limited time. You will not be given much time like Indian studies. So you be given limited time. Within the limited time, you have to complete your task and you need to get your degree and you need to go away. You have to do multitasking. This is so important. In India, we are focused on, especially pharmacy, we are only focused on narrow focus. But in the case of, if you come out of foreign country, you have to be multitasking. You have to do your things at the time. If you want to read a paper, read an article, you have to do it. You have to, if you have assignment on the same day, you have to do it on that also in the same day. If you are having some some appointments to meet someone, to meet some professor, you have to do. So something like that, it's multitasking. And you can work fearlessly in the case of foreign countries. Like you can go anywhere, you can talk to anyone, something like that. You will get more courageous, especially if you are in a foreign country, because it's safe. Most of the countries. That doesn't mean India is unsafe. We are safe in our own way. That's the big difference. And independence. Independence is more important in the terms of researcher's life. If your supervisor is good, you will be allowed to do whatever the things you want, whatever the things you want to expose your studies. So all the above six factors depends upon you. If you really like and if you really follow those six factors, the researcher's life will be enjoyable, or else it will be a big stress to you. So at the end, you will, in a foreign country, you will find out who you are. And most importantly, the foreign life research is interdisciplinary. As I told, it's not like Indian research. If you are studying in pharmacy, like pharmacology, you will do your project in pharmacology. No. So you will, in the foreign country, you will be, although you are from pharmacology background, you will be asked to do pharmaceutical chemistry part, pharmaceutical analysis part, pharmaceutics part, something like that. So it's interdisciplinary. You have to be ready for that. So during research, what are the things you can do? You should do, actually, you should meet the hypothesis, you should find a problem. That's the most important thing. And learn new techniques. You should be ready to learn new techniques, new softwares, new technologies, etc. And you should be ready to solve the challenge. What are the challenges you're facing in day-to-day life? You should be ready to solve. Then you should strong in math. As a pharmacy students, we are all good in maths. Our calculations are good. Those are helping a lot till date to me. So we are already good in that. and you should learn data processing and interpretation. You will learn approach for help from the mutual, like your friend may be working in other lab, and you will also get some help from him, and you will give that help to back to him, something like that. Every experiment you should repeat 3 times. Personally, I do 5 times until I get the concordant values. So this is the key factor in the case of research. You have to document well, you have to write it down every day, every step, every second, every minute, what you have done. If you miss a single step, that will be a big problem in the final presentation or final publications. And manage files and folders. You have to be good at maintaining your files. If someone after your graduate studies, if you want to pull out your data, you should be ready to bring it your data even if it is 10 years later. And collaboration is the vital part. You should open your arms to welcome collaborations from different parts of the lab or different parts of the world. And most importantly, you should convert all your research into industrial applications. So that's the most important thing. That's why Canada is vessel in it, and entrepreneurship. Canada is encouraging a lot in the case of entrepreneurship. So it's a platform, big platform, and big difference when just doing research in lab and converting into a product or making your own company. And just going to talk about research work publishing. So you have to target a journal first, which journal, which area of research you are going to publish, and you have to start working towards that. You have to make your data, your analysis towards that. You should have good English, important, most importantly, while writing. So ready to resolve each problems arised in your experiment. You have to ask yourself a lot. Okay, if you are doing an experiment like A and B, so what will be the answer? It may be D or F. If it is F, why the F comes? Why not E? So something like that it goes, and you have to ask yourself a lot, and you should be ready to resolve by yourself. You should be good at computing. Computer skills are very most important. These days, the younger generations in Korea or Canada, they are very good at computing. Unfortunately, our Indian students, except IT sector, we are not. So please focus on those things. And you should draw your diagrams very clearly, very concisely, very diligently. And you should be finally, you should be a reader. After you complete your manuscript, you should act as a reader, a common man. Just read your manuscript and find out your mistakes. So these are the some steps of publishing. Okay, next moving on to, sorry guys, I'm going to take little more time. Sorry for that. Please pardon me. So entering into different countries like East Korea and Canada. So as a student, you have to have IELTS English score in any form, maybe GRE also acceptable, and apostille from HRD Ministry of your certificates, degree certificates, especially, and a recommendation letter from your previous supervisors like your professors in pharmacy college. So these are the 3 vital things if you want to approach for study in Korea. So yeah, moving to Korea as a student is the best option. You cannot get better jobs because Korea, as like Tamil Nadu in Korea, they give more preference to their mother tongue. Till date, yes, you cannot see everywhere English. So yeah, those are the factors. So you have to consider all those factors, and going as a student is the vital part. But the courses or curriculum are taught in English in most universities. So you may not get a job, but you will get a graduate position soon, graduate student position. In the case of Canada, you can immigrate as a student, worker, or permanent resident. As a graduate student, as a worker, it's difficult until unless you have valid degree. Although you will have pharmacy degree, but you will not just get like a pharmacy job as like UAE or some other Arabian countries. No. Canadian Pharmacy Board is so strict. You have to do minimum 2 years to complete their exams to get a pharmacy license. So the other option is a permanent resident. So permanent resident is kind of attract.
This conference will now be recorded.
If you are completing a master, undergrad or masters also, you can apply for permanent residency. So To apply for permanent residency, you need to have these 5 steps, most important steps. You need to have English score, good English score, and you need to have your degrees evaluated. You should have better score. Every 2 weeks, Canadian government used to conduct a draw. So there will be cutoff mark. So if according to your age, your graduation degree, the cutoff mark changes. So if you have better cutoff score, you will get high chances of getting Canadian permanent residency soon. And once you pass these 3 criteria, Canadian government will invite you to apply for the permanent residency. Once you apply it will take 6 to 12 months and you will get permanent residency eventually. So permanent residency is vital for living in Canada. If you coming as a student and worker, your benefits are limited compared to permanent resident. So these are the things while you need to remember while you're entering into Korea, Canada. So life in Korea. Korea is #1 in innovation and more developed OLED platform. And Koreans don't give up. They will just say whatever the failure they had in their personal life or professional life, they say just fighting and they will go forward. They won't give up that easily. Korea has 4 beautiful seasons: spring, summer, fall, and winter. So exactly different seasons you can see. Korean food is so delicious and so unique, although they use meat a lot, but additionally they use a lot of vegetables, lot of sprouts, garlic, etc. They use only just 1 cup of rice. Maybe this one in that cup, maybe 1 cup of rice they used to have. Usually their food is so healthy, although there are a lot of meat. Korea is so safe. It's way safer. You can go anywhere at any time. It will be more safer, especially for women, for girls. And Koreans like to live independently, even in their very olden days. So they don't give up. They will stay. They will pass away alone most of the day. So they will work a lot until they die. So they don't just sit in home. Yeah, that's obviously me. So Korea uh, promote or encourages having more physical activities. So Korea is one of the place in the world where you can see a lot of marathon races. So I used to participate in marathon races to keep me fit. So these are the things I learned from Korea. So research life in Korea. So it's a timeline-based one. You should complete it in time. Everything is quick in processing. Every instrument, everything is very well updated day to day, and everything is in quick. And you can access any advanced instruments by yourself after getting proper training. And as I mentioned, they are using high-end technology in all the platforms. You will be valued to your knowledge. There are cons also. So since it's a limited time, it will be difficult for some people to cope up with. And since Korea is a closed community, you will not get much exposure unless you know the Korean language. The Korean researchers life will be publication based, so yeah, you have to publish a lot. Some labs you will get a low stipend if you are going by your own than other scholarships. So it's better to go through government or Korean government scholarships. Definitely, Korean life is so stressful. Korea is the another country than compared to next to Japan, where there are a lot of suicides happening every day. So life in Canada. Canadian life is entirely different, I say. Canada is multicultural, so you can see many variety of people in your street, in your neighborhood, and etc. So that way Canada is surviving in its life. It's so cold. Canada is cold. Most of the provinces, states in Canada, they are cold for almost 8 months. So only 3 or 4 months you can see sunshine in summer. And Canada is very beautiful in summer times. Canada has a lot of place, lot of land, so everywhere there will be quiet. You cannot see much people if you go out of the city or town. So how is the research life in Canada? So Canadian life is entirely different, as I mentioned. So independency will be the priority here. So you will get enough time. They won't push you like Eastern countries like China, Korea, Japan. You will have enough freedom to do your work, do your own, and your research will go definitely to high impact. Slow and steady of the curriculum will definitely help you, and you will end up in a better job. But the problems in Canada are they are very slow in progress, sometimes slower than India, and you will have limited access again comparatively to India. They are limited access and a limited guidance. Sometimes, if you are not well reading, well making by yourself, it will be difficult for you sometimes, and it's so much time consuming, and you will obviously your graduation will be delayed if you're doing PhD. I can complete my PhD in Korea. I did complete my PhD in 3.5 years in Korea, but the same PhD here in Canada in my lab, we are doing 4.5 to 5 years. So that's the big disadvantage here. So, and the best place or the better place to choose is it's up to you. You have to sit and read, you have to discuss, you have to see a lot of factors to decide where you want to go. Okay, we are coming to end of my presentation. So this is me. So you can find me here, University of Waterloo, as a senior postdoctoral researcher. I was working as an assistant professor before in Korea. These are the different platforms you can find me. This is my name. Anytime, any help, any thing, I am up for it, because especially I love students. I love teaching. When I was studying in Nanda College, I love teaching. That's why students also love me a lot. So I want to share my knowledge, whatever I learned. I just don't want to take it away with me, but I want to spread it. So that's what I am doing. So thank you for your attention. I am ready for answering any questions. Thank you.
Thank you very much, sir.
Thank you very much. It was a wonderful session, sir. Actually, the attendance has got to know about different technologies as well as the career opportunities, as well as how the foreign life will be. So this will be even more useful for them. So thank you so much for this wonderful presentation. And
You're welcome.
yeah, we are getting a few questions, sir. Shall I pose this question to you?
Yeah, please go ahead.
Yeah, thank you, sir. One of our students have asked, sir, is there any type of disadvantages using silver coating to prevent the microbial contamination? And in that case, what will be the overall cost of the product?
Sorry, could you please repeat the second part? I hear the first part, but I missed the second part.
Okay, sir. Is there any kind of disadvantages using silver coating to prevent the microbial contamination? Or if no, in that case, what will be the cost of the overall product?
Yeah, that's a good question. So silver is being used, and this is being overused, I say. Silver can kill microbes pretty well. There are a lot of advantages out there, but again, there are disadvantages too. So silver nanoparticles are being used in bandages, socks, clothes, so many things, gloves and all these days it's being used. But there are recent reports are saying there may be a chances of a bacteria can forming a resistance towards silver also. That's the one possibility. And again, silver nanoparticles have 5 mechanisms. The antimicrobial mechanism, there
This conference will now be recorded.
also. That's why we are nowadays working on mostly natural based materials.
Okay, sir. Thank you. And one more question, sir. We have received it from Dr. Kumaravil Rajan. What is the possibility of USFDA approval in case you're engineering the polymers, like engineered polymers? What would be the USFDA possibilities?
So polymers, engineering polymer things are going well. I say there are a lot of applications out there. but I don't think that will be considered as a drug. So basically, drugs or drug molecules are approved under FDA, but not the engineered polymer. So if you engineering a polymer, you can sell it your own. You no need to get any approval. You just get your patent filed and you get approval from your patent, and you can start selling it. That's it.
Okay, sir. Thank you. One more doubt arises. Are the surface modified polymers safe?
That's the typical question again. So once they are used in a limited quantity, they will be safe. So the polymers, the polymerization steps, they are using so much toxic chemicals. Personally, I'm also working on polymerizing our cellulose nanocrystals. So we use highly oxidizing agents. So those are definitely toxic to the environment. So maybe the polymerization, the final polymers may not be toxic, but the steps involved in the polymerization, they are more toxic.
Yeah. Okay, sir. And how do you investigate the safety of the surface modified polymers? Like, how do you evaluate the safety in that case?
So we used to have to do it in vitro studies, like using cell culture analysis, and then we go to the animal models, starting from the C. elegans, as I shown in my presentation, and rats and other bigger animals. So initially, in vitro analysis is fine. In vitro analysis, like using cell lines, different cell lines will tell you how good your polymers are, whether they are toxic or not. Yes.
Okay. Okay. Thank you, sir. That's all for the question and session. Now, over to Satish, sir.
Thank you very much, Priyanka madam. So thank you very much for your informative session, sir. It was very informative and very creative also. And also you have explained about Korea and Canada, everything for the researchers. So thank you very much, sir. So without without further ado, we will proceed with second session. For that, I would like to request Dr. Ram Lakshmi ma'am to introduce the speaker, Dr. K.M. Noorullah.
The speaker for the second session is Dr. K.M. Noorullah. He is working as Assistant Professor of Medicinal Chemistry in College of Health Sciences, RC University, Ethiopia. He did his B Pharm from Madras Medical College, M Pharm from C.L. Bedmehta College of Pharmacy, and again PhD from Madras Medical College. We are proud that he is our alumni. He worked as a lecturer in Bapatla College of Pharmacy, assistant professor in Balaji College of Pharmacy, and associate professor in Deccan School of Pharmacy, and now he is working in Ethiopia. He was the college topper in his B Pharm. His research skill includes synthetic organic chemistry, compound separation and purification, in silico studies, docking studies. He has also gained experience in processing and integrating NMR FIDs using Topspin Bruker software. He is also skilled in handling GCMS, LCMS. He has got research grant of 1,10,000 in BIR from RC University. He had authored a book chapter from Springer Nature. He had many international publications to his credit. He has also presented in many conferences. He is in today's session. He is going to give both theory and live demo on Autodoc 4. It will be a great use for all our PG students, research scholars, and also for our final year BPharm students. Thank you, Dr. Noorullah sir, for accepting our invitation and sparing your valuable time. You can begin, sir.
Thank you, ma'am. Thank you very much for your brief introduction. And it's my pleasure to be a part of this webinar series. And I'm very proud that I am a student of 2009-10 batch of C.L. Bedmehta College of Pharmacy. And once again, I need to thank many of them. Just in a nutshell, I thank Professor Dr. Grace Ratnam Madam for considering me for this webinar as a resource person, and all the staff fraternity. I'd like to thank, and without wasting the time, I actually straight away we will be going to the topic. Before that, I want to welcome all the participants, today's participants, for the this webinar. So just I will share the screen. Just one second. Yes. Am I audible, ma'am? Hello.
Yes, sir. Yes, sir. Yes, sir.
Yes,
Yeah.
sir.
My screen is my screen visible?
Yeah,
Is my screen
everything
visible?
clear, sir. You can carry on.
Yeah. Okay. Once again, welcome all. And today's topic, you see, auto docking, a tool for molecular docking. So the topic might be very familiar, like the terms in the topic auto docking or molecular docking might be very familiar for our pharmacy graduates in UG, PGs, all. So why today is auto why as a topic here. Generally, molecular docking, once again, a type of where computer. One second. Okay. Where computers are useful here, but still, if you see, as a pharmacist, we are not a good bioinformatics, including me. All type of generally when they basically, some of them will be very much interested in computer languages, some special courses they might do. In case of pharmacy, I am discussing about in case of pharmacy, some may be very much interested. They use additional language programs, like they been to be as a bioinformaticians. But as a all overall, if you see, non-bioinformaticians find very little bit difficult in terms of computer-aided workups, especially in Autodoc. If you see, it's very difficult because of its lengthy title, lengthy steps, command lines involved, and each and every step can be it will be as a supporting steps. So anywhere, if you do a mild mistake or some command errors, and if you end up with some mistakes, then everything will be in a problem. So if you see, when your approach is like this, but your interest is performing Autodoc, all computer aided platforms to be explored, still the pharmacists feel somewhat difficult. As I once again want to tell you, today we will be discussing some easier approach which can be helpful for beginners as well as some experts. I mean, to say is traditional procedures we are not going to discuss. Traditional procedures once again involve lengthy steps, many C++ commands will be there. So here we will be doing some zigzags. So possibly we will be reducing some difficult parts. We will be just what to say, some difficult parts will be substituted, and it can be covered from other platforms which are very familiar to the pharmacist. So our approach today is possible approach. It will be an easy approach. The very important thing is we will be not compromising any of the docking steps. So I hope, and I hope at the end of the session, the participants will be very familiar with the Autodoc tools, and they may use Autodoc procedures on day-to-day basis for research. So today's content, if you see, we'll be discussing about general term of molecular docking, just in a nutshell, and we will be moving to Autodoc introduction, its theory, and it's some important consideration where I will be giving some flavor, adding some flavor, doing some zigzags, missing something, and substituting some other procedures, so that it will be a possibly a easier approach. And once it is completed, we will be having a short and sweet demo with current COVID-19 protease. So molecular docking. So the term is simple, a molecular docking. As you may know that it is nothing but predicting the protein ligand complexes. So protein ligand complexes in which the ligand molecules interact with the binding site of the receptor. So when a protein and a ligand binds, there will be some conformational changes. So a protein can be at any of the target, and ligand molecules is your compound or your interested molecule which you are targeting that protein. So the molecular docking study just predicts the binding of these two things, like protein and ligand. So this binding is governed by certain types of interactions, like van der Waals interactions, electrostatic, hydrogen bonding, and many such interactions. So it can be a single interaction or a multiple interaction, that does not matter, but always it can be a cocktail, like a mix and mix up of interactions will be there in order to achieve the stability of the protein ligand complexes. So as I told, it is a cocktail of interactions. One or more than one of same or different types of interactions will be there. If you see the image here, it's a protein, and you can see a cavity here. This cavity is it's nothing but it's a protein binding site. A cavity where binding site. A binding site is nothing but it's a region, active site region, the enzyme or active site region, which is a partner site which can accommodate another molecule, or a very important region where many interactive region means interactive residues are highly present, and this region can be considered very crucial in designing the ligands. So based upon this knowledge only, your ligand will be designed. And if you see this cavity, in this image it is a somewhat bigger cavity. So here one site is there, here some site is there. When binding occurs, it can be a competitive binding, or it can be also allosteric binding. So what is the term competitive binding? So competitive binding is nothing but it's a substrate and a drug or a ligand, whatever it is. A substrate and drug can take part in competition, and it will be going. Say for example, this area, this site where A is there. In this site, if a substrate is going to go and bind, and it can downregulate or upregulate. That depends upon the nature of the enzyme and the biochemical process, downregulating or upregulating, or that means it's activating or inhibiting. So in the same place, if it is going and binding based upon the competition, so it can be a competitive binding, and it can be a very crucial one. So if other areas, some other place where the competition does not occur, but it goes and bind, that means it can be termed as allosteric binding. So in many cases, you can see some allosteric type of binding where it takes place. That benefit is here, concentration dependent will not be there. In competitive binding, concentration plays a major role. But in case of allosteric binding, concentration is not a major role. So in this image, if you see here, it can be considered as allosteric binding. So if here the drug binds, it can be also a competitive binding. But overall, if you see, the drug is going to bind in a potential region. So as I already told, the macromolecule once again, it is a chemical mix-up. Drug is also a chemical mix-up. The drug, as anywhere it can go and bind, but finding or our aim, the drug need to go and bind to a potential region is more appropriate, and it will be more meaningful. Why? Because the potential region will be very active, and it can be a very crucial one for any of the upregulation or downregulation of the enzyme. But in case of other areas, anywhere, if the contract between drug and protein has mutual consent, so if they go bind there, there can be a chance like mutational changes can occur, and still even if the drug is going and binding with some other places, there is a chance that existence of activity can be there. Why? Because some of mutational changes, any of surveillance or survival can be there. But if it is in potential site, it can be more appropriate and highly targetable. So always, as a researcher or any design part, you, in case of molecular docking, try to identify a potential region where you can focus your designing approach. So with this, we can go to this general phenomenon in molecular docking. As I already told, it is a docking of ligand with the protein. The thing is, as I already mentioned here, it can upregulate or downregulate. That depends upon pathophysiological condition of the disease or condition of the protein which you are taken for your consideration. But the real thing happens is the ligand is going to mimic the natural course of interaction with its receptor via lowest possible energy. So it is, the substrate will be there. It is going to mimic the substrate, and it is going to end up with a natural course of interaction with the lowest possible energy. So modeling the interaction of drug with its receptor is always a complex problem. So it is because nothing but there are various forces like intramolecular associations involved, like hydrophobic interactions of their dispersion, van der Waals, hydrogen bonding, electrostatic. So this, when you consider this strong interactions as well as weak interactions, cocktail, mix and mix, one or more of hydrophobic or one or more of hydrogen bonding will be there. So generally it will be a very complicated program when it comes like modeling an interaction of drug receptor or simulating a drug receptor interactions. So generally we consider it in a computer program. So on continuation, if you see here, a very important part, the major force for binding appears to be hydrophobic. So very important. So hydrophobic interactions are major force governing the binding, but the specificity lies in hydrogen bonding as well as electrostatic interactions. So specificity can be hydrogen bonding and electrostatic, but the major force is hydrophobic. With this, even steric interaction, here it is not mentioned, but steric interaction also plays a major role in the stability of protein ligand complexes. So in experimental complexes, if you see experimental in protein data bank, if you just retrieve and see the complexes, if you retrieve, you can see many of the steric interactions also are taking part. So it will be interesting if you just have a look on this. So major forces, all forces are very much important. In a nutshell, if you see, hydrophobic is very major force, and the specificity lies in hydrogen bonding, electrostatic, and even steric interactions also. So methods, if you see, generally traditional method, old method, or theory, if you see, means lock and key theory. So we all know about the lock and key theory. So it is otherwise in a physical manner. If you explain, it's a rigid docking. Rigid docking is nowadays not opted or not performed. Why? Because it does not resemble the natural course of interactions. Like it does not rely on reality. Yes. So in docking, what we used to do, a ligand will be there, a compound, a protein, will be there. So both we are going to interact. That's all. So in computer, when the ligand as well as the protein, the target, both will be kept fixed and rigid. So in reality, this both will not be in a fixed form or rigid form. So both ligand, once in reality, I'm telling, in naturally, ligand will be in motion or flexible. Even the target also will be inflexible. So this rigid docking, it's not going to be supported or defended, because it is against the natural course. So still, some dockings, preliminary dockings are performed in a rigid way, that both receptor and ligand are both kept as fixed and rigid. So if you come to the induced fit theory, flexible docking, so it is nothing but rotation of one molecule is allowed. That means you can, anyone you can keep it flexible. Generally, keeping flexible to smaller one is more easy and more feasible. So in flexible docking, you can just have ligand as a flexible residue or flexible one, and protein you can keep it as a rigid one. So nowadays, almost all type of docking, either whatever softwares, Autodock or some other docking softwares, you can go for easily for flexible docking, assuming that protein is constant or rigid one, and your ligand is a flexible one. So it's the flexible ligand is going to be just having some different conformations. So that conformations also can be user defined. In Autodock, 10 up to 10 conformations are, we can just as a default we can fix. So in different 10 poses like conformations, it will have a docking program, and it will give you the most optimum pose. That means the very least binding energy involved in having interaction. So another type of docking also there, flexible docking is there, like both ligand as well as your protein, both will be in flexible mode, and it will be a very realistic natural course of interaction. But it is very difficult if in small ligand itself, if you have flexible nature, it is very difficult in the sense still possible, but difficult in the sense in our it will take days to weeks in our type of a system. It requires high-end supercomputers. So each and every pose it needs to alter and check. In one flexible in ligand flexibility itself, it takes based upon high-end processors are required. If protein also flexible, think it is very hectic. I mean, not hectic, that time consuming and speed required, high-end computers processors required, and good platforms are required. So majority of the cases are like flexible docking. One that is smaller one, that is ligand one, is going to be a flexible one, and your protein which is going to be used for docking will be kept a rigid one. So in Autodock also, some flexible residues you can opt. It's not an issue. Some active site regions alone you can have some you can just identify the flexible residues and keep it as a flexible thing. That is a different story, like different part. Today that just we are going to keep it as a rigid one, and ligand as a flexible, and perform a basic docking, which will be very much helpful for the beginners. So on continuation, this flexible docking, already told that that the ligands will be flexible and they are going to dock into the binding pocket of the rigid protein, a very important rigid protein. So what happens while this process occurs? So binding site, it is broken down into regions, possible regions for its possible interactions. So in the image you can see this it's a binding site from X-ray diffraction, a protein's binding region. If you see that this each and every amino acid sites can have different categories where interactions are more favored. So a drug molecule or ligand molecule enters this cavity. So based upon the mutual understanding, there can be hydrophobic interactions, hydrogen bonding, steric interactions, etc., etc. So it is believed like each and every regions are broken down to possible regions where possible interactions can take place. So here hydrogen bondings, as I told, one or more type of interactions are possible, and in each type there can be more than one of the same interactions also. So this all ends up for the stability of the complex protein and ligand complex. So as many of optimum, once again very important term here, optimum interactions are necessary. Optimum interaction. If there are interactions are more and more, then it will end up with like irreversible thing, irreversible binding. So this protein ligand interaction should be somewhat reversible in order to avoid some potential side effects. In case your target is like pathogenic target, very important. When if it is a pathogenic target, you can even go for a very strong approach of binding, so that if it is in binding, go unintended protein. If your ligand, if it is binding to optimum pathogenic target only, means that does not matter that whatever it is can be strong, even covalent bonding, if it is there also, not an issue. Actually, in ligand and this imaginary bonds are only optimum. If covalent bonds are there, means it is irreversible and strong. It cannot cleave back once again. It cannot be irreversible. It can be considered a suicide inhibitor. So in that type of inhibitors, if it is there, if it is in pathogenic organism or pathogenic enzyme, okay, no issues. But in a host, if it is having some similarity with other enzymes, and if it is going and binding there and forms a very strong environment and binding, means then it will be ending with severe serious side effects. So your ultimate objective should be the idea where which target you are going to use, a host or pathogenic or some other thing, and the optimum interactions, the design, the keys, the ligands should be in such a way that optimum interactions it can be, where it can go bind, upregulate or downregulate. It depends upon the thing it should do, and it should be cleaving, and once again it should be having this kinetic property, and it should go and excrete without any difficulty. So this image tells you that it is like parameterized binding site where possible interactions are favored in order to gain a stable protein ligand complex. So this image, it's like just for understanding target and drug. It's similar to lock and key. So most of the drugs fit well with their targets. So the protein is considered to be lock, and key. If you see this region can be considered as a binding region, and your key will be having just affinity or agreement with that lock. So here, if you see, some locks are known, but not all. So this, if you see, many of the locks are known. Targets are known, but some targets are not at all known. So if you study protein crystals, so this molecular docking, so a very important theory or very important principle, if you see, studying the protein crystals. So to get the details of lock, studying the protein crystals to get the details of lock. If you know the details of the lock, you can design the keys. If without knowing the details of lock, you cannot construct a key, or you cannot design a key. So designing keys can be achieved by computer algorithms. Knowing the structure is very important. So in molecular docking, you need to know the structure of your protein. That means you should have a knowledge, in-depth knowledge of a protein. Then only you can design some keys. Designing the keys can be achieved by computer algorithms, but knowing the structure is very important. So this because the molecular docking comes under structure-based drug design. So in structure-based drug design, knowing the structure, that means knowing the protein, is very, very important. Then only with the help of computer algorithms, you can construct some keys. So other type of as I told, in CAD, one type is molecular docking. If you don't know the structure of the protein, or you have limited information about the protein, then some other tech types are there, like ligand-based drug designs are there, where you can go for QSR models or pharmacophore modelings. Many types are there. In CAD, the one of the type is molecular docking. So it is based upon structure-based drug design. So knowing the target protein is very important in performing molecular docking studies. So this is in this slide, if you see, it is the general representation of docking platform. You see, just ligand, it can be a ligand database from in-house ligand database, or any commercial database, or freely available database, or the like Zinc database you can collect, or you can even from the traditional, you can just filter, and you can have your own sketching in-house database, and from there you studied the protein nature or protein knowledge. You have protein knowledge, then you can perform a molecular docking and ligand dock protein into active site. That is stable protein complex you have obtained. So from that you can just analyze the results. So a very widely used technology here, molecular docking. So you can end up with molecular docking alone, but you can each and every types of computer aided drug design can be utilized in a easier manner for a successful end. So now we can see the docking glossary. It is nothing but like some of the terms or definitions, which is very important. So we can just have a look in this before entering into the main course of program, like AutoDock. So receptor or host or a lock, whatever it may be, it is nothing but it is a receiving molecule. So most commonly a protein or other biopolymer. So a receptor generally it's a receiving molecule or commonly a protein. It can be other biopolymer also. So next, if you see ligand or a guest or here a key, it's nothing but a complementary partner molecule which binds to the receptor. So ligands are our most often small molecules. In our cases, we use only small molecules. So, but it also can be a large molecule like another bipolymer. So it is like whatever it can be, it's a complementary partner. So in some cases, protein dockings are also possible. So where a protein is a receptor, another protein is a ligand. A protein docking also possible. Some cases are there, some studies are there. A ligand is a polymer once again. So next is docking. Docking is a computational simulation of a candidate ligand binding to a receptor. It's nothing but a simulation. So that generally, if you enter into CAD, it's like a simulation. Here, docking is nothing but candidate ligand binding to the receptor. You are simulating. It's a computational simulation. Then binding mode, if you see, it's nothing but conformation. So orientation of a ligand relative to receptor, as well as conformation of the ligand and receptor when they bound each other. So what you can understand, a protein will be in its original conformation, a ligand will be having its conformation. So both, if it is going and interacting or binding, the end conformation, that there is a high chance that it can alter the ligand after binding, can alter the conformation of the protein. So it can also be a therapeutic value, or the response is also a therapeutic value. Like once it is the enzyme is or protein is binding to the ligand, conformation is changed so that the protein got down regulated. That means inhibited. So like that, a therapeutic value also will be there. So the optimal correct pose which is required, the mode, the region where the ligand is going to bind and alter the conformation or change the conformation is known as the binding mode. Then pose is once again a candidate's binding mode, like a ligand's binding mode, pose, which conformation up to conformation. Then ranking. So ranking is very important here, and scoring and ranking. So it is like the process of classifying which ligand poses are most likely to interact favorably to a particular receptor based on the predicted free energy of binding. So each and every software, they have their own scoring and ranking methods, but overall, if it is considered, there is energy variations between the ligand and a protein, and some force fields involved. So interactions, what type of interactions that is taken into consideration, and it's descriptors also, some ways it can be considered, and penalties. So all this comes into matter in scoring and ranking. So at the end, all the docking platforms give you the end result automatically. This scoring and ranking takes place in each and every type of software, as like Autodoc also has their own scoring and ranking, and it will be giving the end result based upon the rank. So the ligand which is having a good binding with the least binding energy is more favorable, and it can be considered as a lead. So next is a brief note on some docking softwares available. Here in this slide, I am just keeping some softwares. But if you see, there are many types of different types of docking platforms are there, including commercial ones. So in a nutshell, I just I am here explaining, just giving the more types of docking platform softwares are available. So when you come to the free ones, if you see Argus Lab, which is developed by Mark Thompson, so it is nothing but molecular modeling, graphics, and drug design program. Very important is it's free one. You can do easily. When comparing to the Autodoc, Argus Lab somewhat easier to perform the docking studies. So next is Autodoc. It is developed by the Scripps Research Institute. The docking software commonly used for docking all kind of proteins and ligand. Once again, very importantly, it is a free software. Then Hex we have, it's also like docking, it's free. When we come to the commercial program, you can see Gold. As a name, Gold, it's Gold. CCDC developed this, calculating docking modes of small molecules into protein binding sites. It's a commercial one. Glide, very favorite, our very favorite software, Glide. High throughput ligand receptor docking for fast library screening. Once again, commercial. So in our doctoral studies, we used this Glide very efficiently here. Then Flux, it's Biosolvit developed, the fast computer program for predicting protein ligand interactions. Once again, commercial. So when you just compare here, you can't compare the free software with the commercial ones. Commercial is always a commercial one, and the speed, accuracy, and the creditability, once again, defendability. So everything just was somewhat having a top priority with the commercial ones. Those who cannot afford for a commercial softwares can go for free softwares. Almost many here, three are there. iGEM docking is there, one-click docking is there. Many types of free softwares are there. So based upon our experience, you can see when comparing to the other free docking softwares, Autodoc is somewhat considered to be more having more creditability and acceptability. Okay, so the scoring also, it is very stringent here in Autodoc, so it is widely accepted. The point here to tell or stress here is the Autodoc based calculations are widely accepted worldwide. So comparison of free softwares, Autodoc is more appropriate and having more creditability and accessibility. But the very important problem here in Autodoc is it is having a difficulty for an bioinformatician to perform it easily on day-to-day basis, because it's a lengthy procedures. I already told it's a lengthy command lines and additional softwares which majorly involved with the C++ commands. So like that, the problems are there. So though students are very much keen, or researchers are very much keen in doing some computer-aided drug design, still they are not doing by themselves. Many of them, many of them are not doing by themselves. They generally outsource this work to other persons. So today we will be just our focus to stop that practice, and they can do it by their own, making it easier. Today's approach will be making it easier so that they can do it on day-to-day basis also. You can have insight in here, insight of much easier approach today. So now we can see the Autodoc. It's as I told, it's a software for predicting the optimal bound conformations of ligands to proteins, developed by Scripps University of Technology. It's a free software. I told it's creditable, having though free softwares. As I told, it's a difficult one. But very importantly, Autodoc is an excellent non-commercial docking program that is widely used. So very important. So I just once again tell the participants to be very keenly listening here from this slide, because here the original the main application is going to come in, take into part. So here, Autodoc tools. So what you are going to do in Autodoc tools? So basically, ligand will be there, a target will be there. You are going to dock it and find out whether that ligand is having a good agreement with the target. Once again, that ligand, if it is having also, what pose will be a better optimal pose, a best optimal pose in terms of lowest binding energy. So if it is having interaction, what are the interactions possible? as I told, a cocktail of interaction or different types of interactions. So these are basic things, but here some things we need to do in order to perform an autodock experiment. So ligand we require, target we require. So ligand from where you require. It is like your idea. You can sketch it. You can have a database. From there you can do target. Once again, it depends upon, it's a user defined. So what pathological conditions you work, or what is your area of interest, whatever it is, all the type of target act like proteins, you can just go to the protein data bank and you can retrieve from there. Two things. So two things, what is the primary inputs, ligand and target, not in autodock itself. Any docking, you need two things, ligand and target. So as the same, here also you require ligand and target. So here something like PDBQT. So, okay, PDBQT. So what is this PDBQT? Each and every docking softwares requires some types of input files. That means ligand can be in mol format, or any in ChemDraw format, or it can be in SG format, that is structured data file, that is standard structured data file format, whatever it is. This autodock especially, it works on unified atom representation, unified atom model, that representation. It is somewhat unique. So this autodock 4 especially, today we are discussing about autodock 4 especially, works on PDBQT format. PDBQT format. PDB means, it's a protein data bank format. That is your protein, when you are downloading from protein data bank, you will download in a PDB format itself. The question comes under how you are going to convert the ligand. So ligand, whatever format it is there, mol or whatever format it is there, you need to convert it into PDB format. So first thing is ligand and target both need to be in PDB format. Target already it will be in PDB format. Your ligand you need to convert into PDB format. Very important step. So once this both are converted into PDB format, initial step in autodock tools is converting PDB format to PDBQT format. So QT is nothing but Q is for charges, T is for atom types. So in PDB format, charges will not be there and atom types will not be there. So preparation of ligand and target is mainly preparing the PDB to PDBQT format. That is, you are going to add charges and atom types so that it will be converted into PDBQT formats. So in autodock 4, this is the only format which the software can read and it can be useful. Other formats other than PDBQT in autodock 4, I'm telling. So in autodock 3 older versions, for ligand different format, target different format was there, but now in autodock 4 they have developed this as a both in PDBQT format. So initial first step is preparing PDB to PDBQT. That is a preparation step. It is very important for converting into PDB to PDBQT for both ligand and target. So this format is very important format, and this format only works in autodock 4. So next, once you have PDBQT for both ligand and target, you are going to prepare GPF file. What is GPF file? It is nothing but grid parameter file. GPF is nothing but grid parameter file. So grid means what? It is like something like a region, a bounding region, very easily bounding region. So bounding region, why it is necessary? It is like I told you, a protein is a macromolecule. Wherever you want, you cannot go and check the docking. I mean, you cannot allow your ligand to go and dock, because a crucial site is very much important. Somewhere other than the crucial site, if it is going and binding, means the upregulation or downregulation cannot be achieved. So therapeutic value may not be there. So a region, particular region is required, so that there you can fix a grid, that is a box, a volume, a region where you are going to play with your ligand for docking. So that is known as a grid. So you need to optimize your grid before docking. So selection of potential region where your ligand is going to go and dock. So that you are going to create GPF file. So GPF file, that file is required. Then another one is a DPF file. So DPF file is nothing but docking parameter file or dock parameter file. So this file is also very important, where you are going to have informations like you are giving informations for software to dock, like which macromolecule you are going to use, which ligand you are going to use, which one is rigid, which one is flexible, what search algorithm you are going to use. Search algorithm means what algorithm, based upon what algorithm the docking is going to be used. Your output here, this AutoDock 4 uses advanced, recently developed advanced algorithm like Lamakan genetic algorithm output. So these all things you are going to give informations to the docking command. So creating DPF is also very important. So 4 things. If you do these 4 things, it is more than 70% done. So preparing PDB QT files for both ligand and target, then optimizing the grid box, that means optimizing the grid and creating the GPF file, then you have DPF file. Then finally you can just go for grid generation and docking command. So grid generation means you have parameter file where you are going to have means you have optimized the region where you are going to dock the ligand, so that maps should be generated. So the end result from auto grid is GLG file. So GPF is a parameter file which your executable command will read, and it will create a GLG file. So GLG file is nothing but grid log file. So with the help of grid log file and with the informations present in the DPF file, the AutoDock will be executed and you will get a DLG file. So just this theory you should understand clearly. Otherwise, docking is very easy. If you understand this, docking is very easy. So GPF file is a parameter file which the grid executable file reads it and creates a grid log file. The grid log file is nothing but it will have informations of maps, fields, coordinates, where the ligand is going to go and fit there. So GLG file will be created. With the help of GLG, the docking executable file will read the information from the DPF file and it will create the DLG file. So DLG file is nothing but your end result. DLG file is nothing but docking log file. So this is the file, very important. With this file, you can analyze the result. If you have your DLG file in your hand, your docking is completed and you can go for analyzing the result. So today's session, we will be discussing what is the importance of converting into PDB QT, and how you are going to create the GPF file, how you are going to create the DPF file, and how important the considerations where we are going to do some zigzags, or what steps we are going to outsource to other type of easily available softwares. These things we are going to discuss today. So don't forget, PDB QT file is very important. That only it can be reading. AutoDock software can be reading. Then GPF file creation is very important. DPF file creation is going to be important. Creating GPF and DPF file creating is very important. Then GPF to GLG important. DPF to DLG is important. Once you got DLG, it is very easy. You can just complete your docking performance experiment. So general steps, as I already told: preparation of ligand, target, grid map optimization, selection of docking parameters, running docking, just analyzing the results. So now this area will be very important. Importance of protein and ligand preparation. So 2 things here. Preparation here will be in 2 cases. Protein or ligand preparation, as such preparation, pre-preparation. So another one, pre-preparation also there. Okay, pre-preparation is done before the preparation step. So here in AutoDock, preparation is generally considered as preparing the protein and ligand into PDB QT form. So PDB to PDB QT form, that is known as generally a preparation step. So before that, another step is there, which is very, very crucial and very, very important. Then only you can get good docking results. So that is known as pre-preparation or pre-processing. So why we are going to do that? So this is nothing but the quality of any docking, it depends upon reasonable, valid starting structures for both cases, protein or ligand. So it is very, 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 very strongly recommended to process protein and ligand structures in order to achieve the best results. So first we can discuss about the protein and its preparation. Okay, so initially we will be discussing about the pre-preparation, that means pre-processing, then the preparation part. So as I already told, protein, that is target, receptor, whatever it is, you are going to retrieve it from your protein data bank. So the thing, the information or a file, whichever you are going to get from the PDB, it is going to have variety of potential problems. So with that problems, not Autodoc, any of the software will not be going to give you accurate or correct results. So this it is known, and it is no big great deal that any of the PDB structure you download from the protein data bank, there may be some potential problems in any of the docking softwares. You need to correct it before you are going to take it as an input file. So now, what will be the potential problems? What are the different types of potential problems generally seen in a protein data bank file? So it can be missing atoms. There will be missing atoms. Some atoms can be missed, so it cannot be recognized while the inventor, author, isolating and purifying, crystallizing, and submitting. That time some atoms can be missed during this characterizations, or any of these invention process, any of these experimental process. There can be waters added. There can be other waters added. Chain breaks will be there. Information about bond orders may not be there. Topologies missing, or formal atomic charges can be information about those things will not be there in the PDB. And very importantly, there can be the protein can be in multimeric form. Multimeric form means it's like more than in one form, like a chain. Similar chains can be there. It can be in dimeric form or a trimeric form. The same chains can be in a multimeric form. So these things, if the your inhibitor ligand is going to bind with the one chain itself in certain region, since in multimeric form, the same ligand pose will be having binding with the same chain in other multimeric forms also. So in that cases, you need to remove the unwanted chains. Say for example, a protein of your interest having A, B, C in a trimeric form. A chain is there, B chain is there, C chain is there. There is no doubt that A chain, B chain, C chain all will be very identical. They're similar, no doubt in that. So your ligand, if it is there, a potential native ligand is there. So if you can see it, yeah, that ligand is going to bind in A also, B also, C also in same manner, same conformation, no issues. So in that cases, B chain and C chain, you can remove it before docking because it will be very identical. But in some cases, if you see a chain of A and B is there, both are same, but your native ligand has some interactions with A chain and some interactions with B chain. In that cases, you need not to remove the B chain. So both chains are to be retained in order to perform the docking. So that is what I just stressed. It is a structure-based drug design. So structure about the protein knowledge without having a full knowledge of protein, performing a docking is going to be end in a fake results. I mean, inappropriate results. So in terms of problems like this, once again, if you see terminal amide groups can be misaligned because you can see X-ray structure. Majority of the structures reported in PDB are based upon X-ray characterization. There are electrons microscopy characterization also, NMR also there. So whenever you just choose wisely, go for X-ray diffraction, it will be more appropriate. So what is the problem with this? If you see, means it cannot generally distinguish between O and NH2 because both are electronegative. That there can be some terminal amide groups can be misaligned. So that is also a problem need to be corrected before docking. So before performing, that is preparing, you need to do pre-process to correct these potential problems. So when you come to the ligand, so how the ligand is prepared, you see, as I told, to get the best results, the ligand should be in grid representation. Actual ligand structure should should be in a good representation, like bad contacts should be avoided or removed, clashes should be not there, and it should be having all bond some ligands you may sketch in this ChemDraw or ACD Chem Sketch, something like that. So there may be bond length differences, bond angles, hydrogen not filled, those things are there. So these things need to be corrected, because at the end you will be having protein ligand complex. It should be more appropriate. So any ligand, if you are supplying it to for docking program, you need to see that it is meeting this expectations, like it should be in 3-dimensional, having realistic bond lengths and bond angles, all. We are going to discuss in demo itself. Okay, then we can come into the very important crucial factor, that is a drug binding pocket. It's once again very important area. You cannot go and duck in a blind region. So identifying a most appropriate region is very important. So you need to know what is that binding pocket, where it is, what it is, like that. So it is nothing but it is having the region, the pocket, where potential hydrogen bond donors and acceptors, hydrophobic interactions, and sizes of molecular structures appear. So you can see this is a potential pocket region. So otherwise it can be known as active site of the enzyme, or it can be known as assembly site with another molecule, that is, it can accommodate the complementary partner. So once again, it can also be known as a communication site, which is necessary in the mechanism of molecule. So this site, identifying this site, once again, a great deal and challenge. Why it is challenge, I will tell you. Earlier, from the beginning, from the first slide, I am telling you, identifying a binding pocket, that is active site, and docking on that region would be more appropriate and meaningful. So the reasons also I have discussed already. So without the potential region, docking cannot be fulfilled or completed with promising results. So active amino acid residues in the protein can be obtained from the parent literature. So you see this protein, if you see these residues, what are these residues? Which one is active? Which one is having potential hydrogen bond donor, so that our ligand, if it is having hydrogen bond acceptor, we can have an interaction here. So you need to know which area we can give rise to hydrophobic interaction, which area can give steric interaction. So this regions site information, from where you will get? You can get it from the parent literature. Parent literature is nothing but where the author who invented, who given the experimental data. So that is very important. So in protein data bank, you can find whatever is submitted, it will be based upon the experiment, not virtual. Okay, the experimental data. From the experimental data, you can get, that is, if you go through the literature, you can study the literature, you can have the in-depth knowledge about the active amino acid residues which is present in the protein. So where the protein parent literature, you can find in PDB itself, the PDB which you are going to select. From that you can have the there will be the link for the parent literature. You can download and go through the thing. So this how this informations are present, because many of the proteins which are isolated and identified, the author itself, he himself or she himself identify a potential ligand which can go and bind there. So with that ligand, with that protein complex, they submit for X-ray characterization and they publish. So that ligand can be your comparable ligand, and that by default you can take it as a standard. That experimental data, standard values, you can keep it as very important, and you can just read out the same native ligand, so that can be useful for your series of ligands validation. whether your docking is very optimal. When you compare the results, then only you can just tell your efficiency of your designed ligands. When you can't compare, then what is the use of having a good score? How you can tell it is a good score? A native ligand, which is from the experimental data, that value can be comparable, and that can be the standard. So if your design ligand having the same binding interactions and less binding energy than that, your ligand can be more promising than the author identified experimental native ligand. So with that information, you can straight away go for experimental studies in order to make your way for further proceedings. So this is about your protein which is having a native ligand. Author who submitted has the what to say, the author who submitted had a potential ligand identified, but not all cases. Many cases, if you see, there are some proteins which are in unbound form, that is ligand free form or apo form. Apo form of the protein is determined without the bioactive conformation of the ligand. In that cases, what you are going to do? That is once again a difficult way. That is, you cannot know the potential binding site. So in that cases, or in some cases, if you can't know the binding site regions, or you have very little information about the binding site region, then what you are going to do is, I told you, grid map optimization. Something like you are going to have a grid volume where you are going to play with your ligands. In that cases, if you don't have information about your ligand, so what you can do, the whole protein, cover the whole protein as a grid volume and perform a docking. That docking can be known as blind docking. Okay, that docking can be known as blind docking. That means you don't know the potential binding region, or you have very little information about the potential binding region, or the protein is in apo form. In that cases, what you can do, the grid volume can be whole protein. You can just cover all the protein so that you can play with your ligand with the whole protein and perform an initial docking. That initial docking is known as preliminary docking. In professional terms, it can be known as blind docking. So what you can do, in a series of compounds, say for 10, 15, whatever it is, series of compound, you just ligands, you just go and perform the preliminary docking. So after that, you just check where these ligands go and accommodate generally. So say for 10 to 15 ligands, you just had a docking experiment. You just see, okay, at this particular region only, this all go and bind. So what you can do, okay, just go for a second round of docking experiments, making smaller grids where the potential binding sites which you observed from your preliminary docking. So this is known as just a refinement of docking. So in case of binding pocket region unknown, you can go for a preliminary docking and identify potential regions where generally ligands are accommodated. That region, you make it as a possible, probable, both ways. You can just make a smaller grid volumes and once again perform a second docking in order to optimize. So now we can see important considerations and stepwise procedure. So basically, these three are very important step in AutoDock 4: preparation of receptor, that means protein and ligand files, calculation of affinity maps by using 3D grid around the receptor and ligand, then finally defining the docking parameters and running the docking solution. These are the three steps. So before discussing about the softwares involved, you can discuss about the considerations. What are the general considerations and stepwise procedure? So as I already told, the preparation step starts with PDB files of the receptor. Protein PDB, you are going to download it from the protein data bank, and ligand from the whatever it is, you sketching or downloading from the database. You need to convert ligand file, that is mol or SDF form, whatever it is, you need to convert in PDB form. Okay, PDB form. So preparation step starts with protein PDB and ligand PDB, in which hydrogens are added to further corrections are made. So further corrections, I told you now, hydrogens added, okay, these things we'll be discussing, and removing waters or some other things. In case of protein, removing non-protein components, water or some cofactors or whatever it is, metal, something like that, and correcting the chains, loops, missing atoms, aligning, bad contacts, reducing. These all things will be done. Then once done, you will be going to calculate the affinity maps, that is grid generation, GPF to GLG. Okay, so it requires the above PDB files to be assigned charges and items. So PDB files to PDB QT you need. Okay, so this conversion PDB to QT means you are going to add charges, add hydrogens, that is polar hydrogens you are going to add, non-polar hydrogens you are going to merge. So these procedures like conversion of PDB to PDB QT can be easily automatically can be done by ADT tools, that is Autodoc tools, and resulting file you can simply save it as protein PDB QT, ligand QT. As I already told, these two formats, that is this format only can be useful in AutoGrid 4 and Autodoc 4. So calculation of affinity mass once again done by AutoGrid exe executable file, and docking can be performed by Autodoc executable file. So algorithm used is Lamakind genetic algorithm. Now coming into the softwares. So softwares, you can install MGL tools. This is the molecular graphics laboratory tools, MGL tools, molecular graphics laboratory tools, where you can have once again a variety of tools, a variety of softwares which is developed by the Scripps Institute of Research. So in that ADT, Autodoc tools will be there, which is more required for our docking platform. So just the link is here. You can just, it's a freely available software as I already told. So just go, you can just click the link and you can go under retrieve and download it. So this procedure, at the end of the session, the organizer, I have requested organizers to share the protocol of this softwares. In that all the informations of installation procedures all will be there. So while they will be sending the protocol for your easy access. So just you can have a look, and those who already have, you can just follow the procedures. So you can see installing MGL tools. It is nothing but molecular graphics laboratory tools. So it will be having Autodoc tools, PyMolecular, that is Python Molecular Viewer, Vision, CAD, something additional softwares. It will be coming as one course that is as a zip file. You can install it. So Autodoc tools will be very important. Then you can see some executable files: autogrid4.exe, autodoc4.exe, and ad4 bound dat files. So these three files, that is these two application files and one dat file, bound dat file. So these two application files, exe files, is very important, as we will be performing some things in Autodoc tools, some things in Windows command prompt. So these two application files can be downloaded by this link, and just it will be giving a WinZip file. You no need to just extract that, just simply click it, and to exe file just copy and just paste it in your project folder, and that is working folder. So creating a working folder is very important in docking, any of the docking performance. So you need to create a working folder, then this exe file just copy it and paste there. That's all. Exe file to AutoGrid 4, Autodoc 4. This link, from this link you can retrieve that. So this AD4 bound dat file, it's a supporting file. Once again, very important. It will be very useful in getting, because this bound confirmations, this bound confirmations will be supported with this dat file. So you need to save this bound dat file in the working folder itself. So from this link, you can just download AD4.1 bound dat file. This also you can copy it in the same project file. This is the very first step you are going to do: installing the software, installing these binary files, application to application file and bound dat file, and creating a working folder. You keep copy and save these files there. Then another one is installing Molgrow Molecular Viewer software. It's once again a free software, Molgrow Viewer. So you can just install, and this software, what we are going to do, you can just pre-process the protein with this software. It's a free software. Pre-processing, I told you, correcting the protein potential problems, correcting the potential problems, unwanted chains can be removed, ligands, if it is there, it can be removed, waters or non-protein components can be removed, some alignments can be corrected. All these things can be done in Molgrow Molecular Viewer itself. Then binding pocket interactions can be accessed. So binding pocket interactions means for site-specific docking, I mean to say, to identify the potential region you can just go for this molecular viewer can be useful, and once your end result docked complex can be explored with this molecular viewer. So then you can see ChemDraw. You can install a ChemDraw including Chem3D. Chem3D is an additional plugin. When you install a ChemDraw, you can get a Chem3D plugin also. So generally go for ChemBioDraw Ultra. So it will be very useful. So here in this our easier approach, this ChemDraw can be useful for sketching the molecules, and Chem3D Ultra you can just use. It can be used for saving the ligand in PDB format. One more advantage in Chem3D is even you can do some energy minimization before converting the into PDB format. So energy minimization. So what is energy minimization? So it's, I told you now, there's own sketching will be there, steric clashes will be there. So if you do energy minimization, you can just avoid the clashes and hindrance. So while performing energy minimization in our demo, I will explain it more efficiently. So very important here is ChemDraw. Once again, it's a subscription software. It's a commercial one. Those who can't afford, so you can just have another method. Alternate method is there. I will be explaining in demo session. So if those who are having ChemDraw software with the license, you can just go for it. It will be very efficient, and energy minimization can be done. It will be more appropriate. If those don't have, only ACT ChemSketch free software only it's available means, so I will be telling you how to convert the ligand to PDB format. Once again, this energy minimization for ligand is just not a great deal, because our ligand is going to be in flexible format. Anyhow, the autodock is going to be generating in different conformations only, possible conformations, 10 different conformations as a default we are going to do. Energy minimization is not very much important for ligands, but still if you do energy minimization, you will get a very good results, because it is going to avoid or prevent the clashes or bad contacts. Okay, it will be I just, based upon my experiments, I'm recommending to go for energy minimization. There are many energy minimization ways you can do, but still Autodock, once again, it is going to do inbuilt, because we are going to do it as a flexible one. Doing energy minimization is optional but recommended. Now stepwise procedure. From here I will be just rushing fast, because the same protocol only we will be discussing in the demo docking. So the first and foremost, after installing your softwares, you need to create a work folder, that is for your job. So already we told na, one project folder you need to create, or demo folder means working folder we need to create, where you are going to paste AutoGrid 4 exe file and Autodock 4 exe file with AD41 bound.file. These three things in that work folder you need to create. It means you need to paste it. So creating a work folder for your job is very, very important. Okay, then what you are going to do, just open run the ADT command, that is run the ADT software. That means you are going to click on the ADT tools. Then the very important, once again, next important step is you are going to set up the directory, startup directory. That means this ADT preferences will be on your this project folder. So you are going to set the preference for your project folder, so that each and every time you are not going to go and search which folder is project folder. So just you once in a while, first if you are setting the directory, so this whole project, this whole process, it will read only in this directory itself. Whatever file is created, it will be created in project file. Whatever file is going to be inputted, it will go from this project only. So setting directory is very important. Then preparing ligand and protein in PDB format, that is initial step. So you need to label as ligand and protein. Yes, I recommend to label it ligand and protein as a target, protein, ligand itself, because here we are going to do it one by one. So each one will have each folder. So there will be no confusion if you keep its ligand and protein itself. If you have some other choice like your name your name itself as name of the ligand, you can go ahead, but see that it is a single word name. That means, say for example, I am KM Nurullah, so I can't keep the name like K space M space Nurullah. Still I can keep Nurullah. So if there is a space between the words for the label of a ligand or protein, the autodoc misreads, there will be some errors. So see that single word name, so that whatever name is okay, recommendation is ligand and protein. So then protein pre-process, I told you, mole grow viewer, you can pre-process the protein. That is correcting the potential problems. Then ligand can be initially prepared in BioDraw, that is pre-processed, and that is pre-processed in the same sense like energy minimization, and there itself you can save it as PDB. Then once this PDB conversions over, that means ligand and protein in PDB, if you have that protein is pre-processed, ligand is pre-processed, like okay, then you need to go further steps for ADT. That means protein preparation. What in protein preparation, what you are going to do? See, don't get confused. This protein preparation, the process of PDB to PDB QT. The earlier one which you did is pre-processing, that is correcting the potential problem. Okay, so these steps and all we are going to perform in the demo docking. So just I will tell you what we are going to do here. Just you are going to read the molecule, adding hydrogens, edit, add polar only. So you are going to add polar hydrogens only. So why it's polar hydrogens alone? So polar hydrogens means what? So polar hydrogens is nothing but the hydrogens which are going to be binding or attached with the electronegative atoms. It can be oxygen, nitrogen, whatever it is. The hydrogens which are attached to the electronegative atoms, that hydrogens are added. So if that hydrogens may not be present in the PDB file, so you are going to add the polar hydrogens. The hydrogens which are attached to oxygen and nitrogen, that means electronegative atoms, they are polar hydrogens. So all the polar hydrogens need to be added in the preparation step. Then edit hydrogens, merge non-polar. So why you are merging non-polar? What is non-polar hydrogens? So non-polar hydrogens are nothing but the hydrogens attached to carbon, that is merged. Okay, so next you are going to do edit charges, add Coleman charges. So here very important, I told you, preparation of PDB to PDB QT file. Charges need to be added. Very important step. If you skip this step, your thing will be very perfect, because PDB QT only very important. That only will be read by the Autodoc 4. So adding charges is important. So once again, if you click that option, Coleman charges will be there, gas ticket charges will be there. So why Coleman charges for here? So Coleman charges generally it is nothing but it's a representation of amino acid template, like amino acid template which are derived from electrostatic forces and quantum mechanics. So if it is a larger molecule, if it's a larger molecule where amino acids are involved, better add Coleman charges. Okay, because it is a template, amino acid template, representation of amino acid template derived from electrostatic forces and quantum mechanics. So whenever a protein or whatever it is, whenever the amino acid involved molecule, macromolecule, whatever like that, you can add Coleman charges. Okay, then this repairing missing atoms. So the earlier what we told, mole grow molecular viewer, there we are correcting some potential problems I told. So only missing atoms cannot be done there. So this you can do it in ADT itself. So here also you can do the first step after reading itself. You can just repair the missing atoms. After that you can add hydrogen and all, no issues in that. Then finally you can just go for write PDB, because it is in also PDB. These things you have added now, changed, these things are done. So you can just write PDB, sort notes. Sort notes means like the notes which are going to be, that means the sequence writing. So it will be written in the sequence. See that only sorts node are checked, other things just unchecked, because other connections and all. If you this means this checked means the writing PDB option will be in other format. That means other unnecessary formats which we will feel somewhat difficult in performing. So just to see that short notes are checked, that is the atomic information, that protein data sequence will be in order in a proper sequence form. So once you can just, it will ask sometimes overwriting, because PDB, once again overwriting PDB, just you can pre-process to somehow processed protein, so you can just accept overwriting. Next, ligand preparation. If you see ligand, you can just open the ligand file in PDB. Then it is interesting factor, torsion tree. So you need to detect the root. Torsion means what? First torsion means what? It is nothing but like it represents the rigidness and the flexibility between the atoms. That means your ligand, how much flexible, how much rigid. Okay, so torsion, almost there will be only one root in your ligand. There will be almost only one root will be there, and there can be 0 or more branches in your ligand. 0 or more branches can be there. All the branches can be nested, and each branch can be defined as one rotatable fragment or rotatable bond. Okay, you can understand what I'm telling. And whatever big your ligand, that doesn't mean you can just have one root in that. From that root, you can have branches. So all the branches can be nested as one, and you can see each branch can be considered as a rotatable. So basically, this torsion, I told you, like it is like describing or representing the flexibility and rigidity of your ligand. So what is opt torsion we require? So it will be in the numbers. I said, see here, set number of torsions 1 to 6. So it will be numbers. Simply, if the torsions are more, what is understood means, if the torsions are more, that your ligand is more flexible. Okay, more number of torsions, more flexible. So if the ligands are having more torsions, more flexible. Okay, so more flexibility, if it is there, then it is more complex. It is very difficult to find out which optimum pose is having a good binding. So it is difficult for us, for even computer, to find out the best pose which is having least binding energy with the protein. So the flexibility also should be in a limited range only. If it is more flexible, it will be time consuming as well as the difficult protocol. So what, based upon the literatures and references, 1 to 6 you can have, you can fix the active torsions, so that with that you can just have optimal results. So if your torsions are close to 1, it is understood that your ligand is rigid. Hope you understood this. If your torsions are set to 1, your ligands are too rigid. If it is 6, okay, automatically these torsions are set by the ADT, but still you can make it to 6 or 5 or 7 or 8, whatever it is. Auto set, it will be just giving identifying and telling you the torsions. Sir, my ligand has 7, sir. My ligand has 8, sir. But in your procedure you told 1 to 6. Okay, no issues. You can go for 8, no problem. Just for based upon the literatures, we have fixed that 1 to 6 means okay. You can just, from 8 it is showing, you can make it 6. No issues in that. Okay, no issues. But you see, in some literatures, they are telling the autodoc you can go for up to 14 also. Some literatures you can say up to 20 also. User guidelines based upon the Scripps University Institute of Research, what they tell, up to 32 torsions are allowed. No issues. Autodoc can go for up to 32 torsions also. But if up to 32 torsions are there, means flexibility is more high. So the result will be somewhat it will be very difficult to identify a best pose. So 1 to 6 is more prominent, and if you want, you can go for 7 or 8, nothing, no issues. Okay, then aromatic carbons, automatically this Autodoc detects aromatic carbons and aliphatic carbons. So here one aromatic criteria and the cutoff angle 7.5, generally it automatically fixes that, and if it is there 7.5 you can just go ahead. Then here editing charges compute gas taker charges. In protein, what I told, it is Coleman charges because it is a representation of amino acid template. I told na. Gas trigger charges, it is like a representation of electrostatic electronegativity representations, charges derived from electronegativity representations. So for small molecules, okay, small molecules or organic molecules, so if you go for charges, you can go for gas trigger charges, okay, for small molecules. Okay, for that also you can just for protein also you can go for gas trigger charges, but since it is very unique and specific, you can just for proteins you can go for Coleman charges. Here for ligands we are going for gas trigger charges, right? Gas trigger charges, automatically the software adds the charges, but still you can also add at the end step before saving it to PDBQT. Next, here two things are there. Protein is prepared, ligand is prepared. So very first step in GPF5 creation is converting your macromolecule to PDBQT. In ligand preparation, you are converted into PDB, but in protein preparation, you just kept in PDB only. So ligand PDB over. In grid parameter file creation, first step is converting, saving as PDBQT. Then here you can see for preliminary blind docking, how you are going to optimize the grid volume. So you see here, when you choose preliminary blind docking, when you have no information about ligand sites, that is potential regions, so that time you are going to go for preliminary blind docking. So in that, what you are going to do, molecule you are going to choose, ligand you are going to choose, grid box. The grid box here is you don't know where your potential region is, so the box should be covering whole protein, and the GPF file you can save it as grid.gpf. But in case of site specific docking, you know where is the actual the protein has a ligand. In that case, what you are going to do, you can just identify the region and you can optimize the grid. So for that, what you are going to do is the same step, protein PDBQT, select. Before opening the grid box, you can just open the MolGrow viewer and import the raw protein. That means the raw protein, from the raw protein only we have pre-processed, right? So without pre-processed, that from whatever you have downloaded from the protein data bank, that protein you can just open in MolGrow, and from there you can explore the active amino acid residues having interaction with the native ligand. That amino acid you can have just note, and you can note it in any you can note that amino acid residues. That amino acid residues you can just highlight in the protein in ADT. Then once it is highlighted, you can see where these amino acid residues are there. There you can just create a box, that means grid volume. Now you can just save this as a grid. This is more specific site specific docking. In demo, I will be performing this site specific docking so you can understand better. So you see here, if it is blind docking, whole protein. If it is site specific, in MolGrow, identify the active amino acid sites, note it, and you highlight that amino acid residues in this protein. Once the color is changed, you can easily see where the active amino acids are there. That region you can cover it with the box, and that grid box. Then you can save the GPF file. The next is creating DPF file. Creation of GPF is over, and creating DPF. That DPF is just, I told you, setting means setting the what macromolecule you are going to use, what ligand you are going to use. So macromolecule rigid, ligand is flexible, it's accepted. That docking search parameters is genetic algorithm. By default, you can go with this genetic algorithm. Talking output, it's the latest one, Lamacan GA genetic algorithm. Say you have DPF file. So now you have in your working folder, you can have this working folder is having the executable files, binary files, PDBQT for ligand and protein, GPF file and DPF file. Next, you can go for creating GLG file, that is grid log file and doc log file. The doc log file is your end result. So how you are going to just Autodoc also you can do SIGWin. Traditional procedure is SIGWin. That is all confusing. Here we are going to do it in Windows itself. Windows command, just open command prompt in Windows. Okay, so that just command prompt you can open, and you can just go by your go to your destination folder by using cd commands. So in demo we will be performing that. Then you can simply go for two commands only. Here only two, creating glg file and creating your doc.log file, that is dlg file. This is your end result. So what is this command? Very simple. You no need to get confused with this. GPF to glg, that is grid parameter file to grid log file, can be done by auto grid for exe file. So simple command is just once the destination folder, you are located to destination folder in command, just type auto grid 4.exe space -p. P here is parameter file which is going to be read by autogrid exe. Okay, so understand clearly. So this -p, p is nothing but parameter file which is going to be read by autogrid exe. Then space l. This l is nothing but log file which is going to be created by autogrid. P is read by autogrid, l is created by autogrid. So autogrid 4 -p parameter file, that is GPF file, which is going to be read by this executable file, -l. L is nothing but log file which is going to be created by autogrid. That's all. Once you do this, click enter, wait for the response. The same thing only here I have given this space, 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 space. Once the response is over, that finished, you can just check whether glg file is created, map files are there in your working directory. Once it is done, you can just go for final docking command. So here docking can be done by the autodoc4exe. So type autodoc4.exe -p. P is parameter file which is going to be read by autodoc, and l is log file which is going to be created by autodoc. So doc dpf -l doc dlg. So wait for the result. Now once doc dlg file is created, it is your docking result. So analyzing, if you see, means in autodoc itself you can analyze. It is like a dlg file you are going to use. Then you can open macromolecule, you can choose the macromolecule conformations. This we can go and just do it in demo. You can get the full details, like what is the energy, what are the interactions, docked molecule pose, that is docked complex pose you can get, and even you can go for this predictive Ki inhibition constant also you can get. So these informations you can just explore in analyzing part. Then by this you can all just have the wonderful docking results. Interactions can be done by interaction exploration. You can do it in molecular molecular viewer, and you can save the interaction image, and you can just change the extension of DLG file to TXT, so that all the docking results, what happened inside, everything you can visualize in Notepad itself. And I hope this current protocol will help you in running ADT day-to-day base. And here is my contact mail ID. You can just call me anytime. And now, without wasting further time, we will be going for demo docking. Okay, demo docking. So demo docking, if you see, means I have already installed the MGL tools. Once you install the MGL tools, you will be having 1, 2, 3, 4. These 4 softwares will come as a MGL tools. So this one will be working much more. Then you can see I have already installed molecular mole grow viewer. Here it is. Then I have ChemDraw software. I will tell you how without ChemDraw also. This is ChemDraw software. This is Chem3D. That is additional plugin with ChemDraw. It will be there. So if you don't have, I will tell the alternate. No issues in this. So ChemDraw is there. This is ChemUltra 3D and demo folder. It is my web folder. I have already created the demo folder. So this is demo folder. Already I have downloaded. We can just cut it. So first I have created a demo folder, and this AutoGrid4, AutoDoc4 application files I have copied, other downloaded, retrieved, and copied here in the work folder. Then AD4 one bound dat file, supporting file, dat file, that also I have downloaded and copied. Now this ligand today we are going to do in this native ligand itself. Okay, the ligand which is already present, that is potent site specific docking we are focused now. So that native ligand itself I am doing docking today, I will be performing the docking today. So you may have that series of structures you can also perform in your own way. So this folder I have been having. Now just we can download the protein of our interest. Okay, so ChemDraws I told you, this Autodoc tool, small grow viewer. This is sufficient for this study, docking software study. So I will be going protein data bank. Oh my God, what happened? Hello? Hello? Okay. I'm online.
எப்படி கனெக்ட் பண்ணோம் அது எப்படி சார்ஜிங் பாப்புலேஷன்
Hello, sir.
Yes, sir, you are on online.
Okay. But I don't know why this is not working. I'm very bit. Still online. 1 second. One second. I'll see. Otherwise, I already downloaded protein is there. I will just go with that. Oh my God, what happened?
ஸ்ட்ரீமில் போகணுமா டெமோ ஸ்ட்ரீமில் லைவ்ல இருக்குமா டெமோ காட்டுறது லைவ்ல வேணுமா
1 second, I will disconnect and once again I will get in connection, madam.
லைவ்ல போய் தனியாக தான் அப்லோட் பண்ணுறேன் லைவ்ல போக முடியாது
Yes. Now is okay, ma'am? Now is okay?
Yes, sir, it's okay. Yes, sir, it's okay. It's visible.
Okay. So, okay, this is a PDB, protein data bank. Sorry for the interruption, some internet issue. So, okay, it's a PDB data bank where you can just get everything, any target you can get. It's a larger repository where biological macromolecule structures which can be retrieved, and it's constantly updating PDB. You can just now, third question time, you will be going, as I told, the COVID-19 protease. We will be just downloading that protein. So you can just COVID-19 protease. It's like a C3C16 type of protease. Just you can see. Yes. You can see many the results. You can have 17,000 structures of this COVID-19 related proteins. So structure of COVID-19 main protease bound to potent broad spectrum non-covalent inhibitor. So here if you see 6MO3 once again the crystal structure of COVID-19 main protease in apo form. See, both are COVID-19 19 protease only, but this is in unbound form, apo form. The author, didn't identify any potential problem, sorry, potential ligand, simply isolated in X-ray diffraction. So just in apo form. Here the potential region is not known, but in this, the author, you can see he identified a potential inhibitor. So here choosing a protein with inhibitor is more appropriate, you see, so that we can go for site specific docking, site specific. So docking, your docking performance will be more appropriate when you go for selective potential region. So this both are COVID-19 only, but I will be going for this this protein because it has inhibitor. So still you can go, many COVID-19 proteases are there, you can just go, but that identity means the filters which you need to use in selection of a protein. If you see primary filters, if you see there may be anything, just method X-ray diffraction if you go for, means it will be more means very good if you go for X-ray diffraction. And once again, another filter is what is the resolution. So always go for a resolution where it can be around 2 Armstrong at least, so that the experience or performance will be very good. So if you see, interestingly, this protein has a protein inhibitor, which is our primary criteria. Then it is X-ray diffraction and very recent protein, and 2 Armstrong, that is 2.1 Armstrong. So this will be more good if you go for that. You can see here 1.83, 1.65. So it's just it's like various filters. More than one author can be submitting the protein. So while filtering, you go for a best one and choose very wisely. That see that some filters are there, so that you can just go with X-ray diffraction to around 2 Armstrong and go for some inhibitor based protein. So just click this. You can just have detailed information about this submission. You can see classification, all things will be there. So classification, organism, which is coronavirus expression system, then the validation report of this PDB. Simply go down literature. Oh, you are unfortunate that the literature is yet to be published. It's a very recent one. So once it is published, you can just go down, download this, and you can just have a in-depth knowledge about this protein. Then if you see, still scroll, all the sequence featuring everything will be there. Then here, ligand. So what is this ligand? This ligand is the potential inhibitor which the author identified, which is very potential. So if you just click this, if you have Java platform updated in your system, you can just see this is the ligand which the author identified as potential. And here we are going to name it as, it is a native ligand. It's an external ligand. It's a potential experimental data ligand, experimental ligand. Native ligand. So today's demo docking, we will be doing this same thing. Okay, this as a ligand we will be considering and we will be performing. So you can just perform whatever ligands you have. You can just go and perform. And doing a native ligand docking is very important because it helps for validation of your docking. Because removing this ligand and once again performing, and you will get the value, because this is identified as a potential ligand, and it is identified in experimental it is identified in experiments, and experimental data is provided for this. So it is more appropriate and very genuine data. So whatever we are doing is our virtual predictions. So you can dock this, and for your procedure, whatever the docking score is coming, so you can just easily compare with this experimental ligand docking scores. So hope you understood. So straight away we can just go and download the PDB file of protein. So just I'm PDB download files. Go for PDB format, which is very important and very requirement. It's a requirement to download it in PDB format. Just download, and here it is downloading. Once it is the raw protein. Okay, unprocessed protein, raw protein, which we have downloaded. Okay, so just show in folder. Copy it in your working folder. Which is your working folder now? demo is your working folder. I have copied. Okay. Now I have already sketched the that native ligand. So I will be opening. You see here, demo folder. Where is demo folder? This is ChemDraw format. I have sketched in mole format. So where is the mole format here? You can just mole format. Ligand is there. Now you see, this is the external ligand after divide. I have already sketched here. You can see here. The same thing I have already sketched. Okay. So you can use ChemDraw, ACD, whatever it is. You can save it in mole format. So just I have saved and already saved it in demo folder. Now you can just pre-process. Now you see demo folder has a raw protein and your ligand in SD format, standard structured data format, and your these three things. So now first we can go for pre-processing the protein. So pre-processing from where we can do, I told that is from molecular mole grow. So pre-processing is to correct the potential problems. Okay, so mole grow viewer, you can just open mole grow viewer, and here it looks like this. Here this is the workplace and various tools involved here. Just raw protein need to be corrected. Okay, so just open, and desktop, your demo folder, that is working folder. This is your raw protein, just import. So now you see the raw protein contains water molecules, 281 water molecules. That protein has one chain. Interestingly, one chain only present. This A chain only, no multimeric form, dimeric form. So only one chain. So that one chain we are going to retain, and one ligand. That ligand is the potential ligand which we are going to dock it for today. So this ligand. So water molecule is a non-protein component. Ligand is also here non-protein component. You need to remove it before. So I told you now it is structure-based design, drug design. The whole thing which is very important is that literature you need to study, and any water molecules are very important, or any water molecules are involved in the enzymatic activity. Those things need to be studied, and that water molecule alone you need to be retaining. Other water molecules can be removed, because while retaining non-protein components, adding hydrogens, processing and charges makes additive to be more difficult. So unwanted things you need to just remove. So here water molecules, since a very new protein, and literature also yet to be published, we don't have information about the water molecules. So we are just going to delete all the water molecules. Protein means protein we are going to retain, and ligand is a non-protein component we are going to remove, and our ligand is going to be our ligand is once again the native ligand. So simply import everything. Just the workspace, now you can see raw protein is been imported. So in the raw protein you have ligands. You can see this is the ligand, native ligand, and this is protein. Water molecules are there here. Water molecules full of 281 water molecules are there. So you see water molecule retaining. Which water molecule is very important, that will be obtained from literature. So one good example is HIV protease. So in HIV protease, there is a one water molecule which is very, very important and essential, because this water molecule only has very important interaction, and flipping can be controlled by the water molecule. In that case, HIV protease case, you need to retain that water molecule. Okay, so here, since the data is new, so we are just deleting all the water molecules. Once it is literature is published, we will be having further refinement. So how to delete? First, unwanted things, water molecule, just right click, remove all water molecules from workspace. If it is specific water molecules, means you can just click, you can open the tree and you can just click specific water molecules. Since I don't want all, I don't want water molecules itself, I just cleared all things. Then ligand. This ligand is non-protein component. I'm removing all ligands from the. Now you can see only one chain. You can once again cross check. It is only one chain. A chain is there. B chain, if it is there, means you can click and remove that B chain. So only one chain is there. It is in single form. and water soluble removed, and ligand also removed. Now you can just prepare it. That is pre-processing. Once again, tools, prepare molecules for this protein, just preparation. Assign borders if missing, assign bond orders and hybridization if missing, create explicit hydrogens, assign charges, detect flexible torsion ligand, assign to this all thing you can just prepare. If it is missing, it will correct. You can see missing atoms is not there here. So missing atoms can be possible. So this missing atom, since in Molgrove viewer it is not there, that missing atoms alone we can perform it in ADT, Autodoc itself. So okay, now I'm just preparing. You can see the response here. Done, processing macro. So this processing is done. So once it is done, you can just export molecules, protein, one single file, that is only protein, one single file, just export it. It will be, you just go to the demo folder, your working folder. Here Sybil mold to format is there, just to change it to PDB format, which we require. Already protein is there in this. It is PDB file. Now we are going to, so okay, it's not MNM, no, it's CL byte, right? Our demo folder is desktop demo. Okay, it is raw protein. We are going to just ligand. Okay, no, it's not ligand, no, protein PDB form. Already in our working folder, one protein is there. It is raw protein. It is pre-processed protein in PDB form. Just it will be in this mole format. You just convert and save. Now it is over. Now you can see here demo folder. Protein is there in PDB, that is pre-processed one. Ligand in SD form file is there. This raw protein is there. Now you can just prepare ligand. I told you this is already sketched in mole format. It is there. Now I will save it in PDB format. Before that, in Chem3D you can energy minimize. So how you are going to energy minimize? Just open 3D, open your ligand, demo folder ligand. Just open. This is your ligand which I have sketched in 3D form. You can see, you can go for energy minimization. So I told you energy minimization can remove clashes, steric clashes. Say for example, here one rotatable bond is there. Here stereochemistry, okay, stereochemistry, steric clash. It is this contact is bad contact. More energy is there, so it is just very close to this rotatable bond. Because of this clash, this rotatable bond movements, rotations can be prevented. So once you minimize the energy, this bad contacts and will be prevented, and steric clashes can be avoided. So what you are going to do, you are going to minimize that. So you can go for molecular mechanics MM2, minimize any of the things. You can go for, say for example, small organic molecules, you can go for MM2 itself. Run, minimize job energy. Okay, just all iterations run. Just you can see it is minimizing. So the steric classes can be avoided. So these games, Gaussian and all other for dynamic simulations, you can use that energy minimizations. So many types of energy minimizations are available. So here for small molecules, you can go for MM2 itself. It is very important, very optimal. So now it is done. So energy minimized. It's a feasible organic molecule. Now you can do file, save as. Now this ligand, you can save it in PDB, any format. In 3D there are many formats you can save it. Just now we want PDB format, so ligand dot PDB, just save it. Now you can see here ligand in PDB file, protein in PDB file. We have done this. This is the initial work which we do. Main input over. Now the next step is PDB to PDB-QT. We are going to do that. We are going to do in Autodoc tools. So just double click this Autodoc tool. Here you will your Autodoc tools will be just opening. just a time constraint is there, so I will be running the commands. We can skip because time also constraint. Just loading over. Yes, this is Orthodox software, which it looks this way. So this is workspace, and everything is there. First step I told you, setting the preferences. Preferences, file, preferences, set. So this is here. This is in some other directory. Our work folder, if you see, it should be in demo. So what you can do, this is our work folder. Okay, so just in demo, this you click, you will get the full path of this demo folder. Just you copy it, and you set up set directory, startup directory. You just paste it. Now it is set into your working directory. Now just click set, dismiss. Now setting directory over. Now whatever if you open, it will be taking you to that directory only. So now next step is read molecule. Your macromolecule, just see, it directly takes to your working directory. Read molecule, that is protein which is pre-processed. Okay, this is protein pre-processed. This is ligand. This is protein. Protein pre-processed. Open. Now your workspace will have your protein. This is your pre-processed protein you will be seeing in your workspace. Now what you are going to do, one step we missed, right? Pre-processing, repairing missing atoms. Just edit, miscellaneous, repair missing atoms. The Autodoc automatically repairs the missing atoms. So once it is done, it's finished. Now next what you are going to do, hydrogens. You need to add hydrogens, polar only. The hydrogens which are going to bind with the having interaction with hydrogens attached to the electronegative atom only. So polar only, click. All the polar hydrogens are added. Now you are going to merge non-polar. The hydrogens which is attached to carbons are merged. So the hydrogens are merged. Next, what you are going to do, charges. Very important. Charges, you can see Coleman and gas trigger is there. Since it is a macromolecule involving amino acids, you can just add Coleman charges. So you can see total Coleman charges added. Now once this is charges are added, you can just save, write PDB. Write PDB. So this is PDB. Input file is PDB. We have added charges, hydrogens, everything. Now we are going to save this as a same PDB itself, but already one PDB is there now. That we are going to write override. Then before that writing options, you can see sort notes. I told now the writing that sequence of amino acids, it will be in correct sequence. So sort notes, this two you uncheck. It should not be checked because only sort notes is sufficient. Other connecting records, all these things will be getting confused in our procedure. So only check sort notes and give OK. It will ask already PDB protein exists. Just we are going to overwrite with adding charges and all these things. So we have overwritten. Now what you are going to do? Now you are going to go for ligand. Still we have not converted this as a PDB QT, right? Before that ligand, just open. In working folder, nothing is there because here extension is PDB QT. So go for PDB files because we kept ligand in PDB file. Now just click, open. Now you can see your protein, your ligand appearing in the workspace. So there is a summary of ligand which automatically done. So you can see this summary. If this is the ligand, automatically gas trigger charges added. Okay, automatically added. Merged with 31 non-polar atoms, non-polar hydrogens atom, merged. Found 14 aromatic carbons, detected 9 rotatable bonds, and torsions, you can see automatically set to 7. These are the summary. Okay, you can just click. It is the ligand here. Now what? Already these things done, but once again we can just detect the root. In torsion tree, detect, automatically detected. So just go set torsions, number of torsions. So fewest atoms 7. I told you now, automatically set torsions, active torsions 7 are there. 1 to 6 is okay. or you can go with the 7 itself. Since it is demo, I will go for 6. You can go for 7 also. If active torsions in it is 9, you can go for 6 or you can go for 9 itself, no issues. 6 is most based upon the literatures, you can 6 is okay. So then set, then dismiss. Then aromatic carbons, you can go for aromatic criterion. Interestingly, it is already 7.5 cutoff angle, so this is okay. You can go for okay. Then you can go for output. Then you are saving ligand as PDBQT, one of the first criteria. So ligand, see that it will be in demo folder because it will be, we have already set into that category PDBQT, ligand PDBQT over. So working folder, if you see, means now ligand PDBQT file is ready. Protein is still in PDB only. So what the steps we have done now? Protein imported, charges added, hydrogens added, then saved as a PDB itself. Then ligand we have imported, torsion set, aromatic criterion set, ligand saved in PDBQT form. Now you can just step is grid optimization. In grid optimization, first step is converting the protein into PDBQT. So grid macromolecule, then you can just choose your protein, ligand at protein is macromolecule, not protein, select molecule. Now it will ask to save it in PDBQT. So you can see demo folder protein in PDBQT file, PDBQT. You are saved in PDBQT. So it is in charges and atom types added. Here also charges, atom types added. Now you can just see here in demo protein PDBQT ready, ligand PDBQT ready. Then you can see now next is macromolecule over set map types. So what map types? So for each and every atom of ligand with respect to the protein, maps should be just generated. So set map types, choose ligand, because each and every atom present in the ligand need to be creating the maps. So choose ligand. Which is the ligand? Here, choose ligand, select ligand. Now next is grid box. This is very important. Grid box. Okay. So if it is preliminary docking, that is blind docking, you don't know where is the region is, simply click the grid box and you can just cover a whole protein and do the docking, preliminary docking. Then after that, second docking you can do. So in our case, we know what is the potential site, because the protein, raw protein has the potential native ligand. So we will be performing site specific. So when the site specific docking comes to in a role, before going to grid box, you need to know the active amino acids residues in that. So for that, what you are going to do, mole grow viewer, you just go to the mole grow viewer, clear the workspace. Now import the raw protein, unprocessed protein. Raw protein you just import. While importing this water unwanted, you just unclick so that water will not be imported. Only protein and ligand only will be imported. So import. So now ligand and protein is there without waters. So this is raw protein, natural ligand. So what you can do is simply, and ligand map on option is there, ligand map. So just click the ligand map. This is the native ligand in raw protein. Just what you can do, make it big, show interactions of this ligand in this protein. So you can see, zoom in, this is the ligand. So here hydrogen bonding is there, electrostatic, you can click steric interactions. So you can just see this interactions are there. So these are the amino acids which are present in the protein, which is taking part in the interaction with your native ligand. Is it right? Okay. So you can see blue color interactions are hydrogen bonding interactions. So red color one, steric interactions. So these are the amino acids. If you want, you can just increase the threshold also. so that all many types of interactions can be taking into consideration. So by default you can go. Okay, so these are the amino acids which are very important or which are very importantly taking part in the interaction with the ligand. So what you can do, you can take a note on this histidine 163, serine 143, amino acid residue number. You just note it in a paper, and you can just go to the Autodoc environment here. So already I have noted the amino acids present in that. So what I am going to do, how I am going to identify the region in this where it is the active amino acid residues. So what you can do, I have the information about the amino acid residues. So just here you can see all molecules tree. Here in this you can just click a protein here and a chain here. Now you can see all the amino acid residues present. So it will be in sequence 1, 2, 3, because short notes we have given now, it will be in the sequence. So just you can see here this all these areas. So each and every option has different categories. So here you can see select deselect protein, that select deselect amino acid. This you can see display and display lines for protein. This if you see display and display stick and balls for protein. This if you see display and display atomic spheres of protein. This ribbon, this molecular surface, this labeling option. This last one very important for our site specific display coloring menu for representations of protein. So this last one will be useful, coloring menu options. Okay, last one. So what you can do, I have already from this I have already noted this. You can see ASN 142, that is arginine asparagine 142. So what you can do, just to scroll and go to 142 residue at ASN 142. Yes, here ASN 142 is active amino acid residue present na? So you can just what you can do, ASN, this last display coloring option, just click, it will open geometry filter. In color scheme you give rainbow. By rainbow, this amino acid residue you give rainbow. You can see here this amino acid now it is in rainbow color. This amino acid is in rainbow color now. Okay, next amino acid which I have saved is noted is glycine 143. Here glycine 143, just here you click, give rainbow. Here you see here rainbow came. Just you can just identify here this residue. Then I have cysteine 145. Cysteine 145. Just to click by rainbow. Yeah, here it is. Here rainbow color. Then 163. Cysteine 163. Just click by rainbow. Yeah, here. Then 164. You can see. Just you can note it and you can just highlight. Then methionine 165. You can see, click color scheme by rainbow. Yeah, here. And then GLU 66 by rainbow. Okay, here. If you have doubt, means you can just what you can do. This 166 fully will disappear if you just undisplay this protein amino acid. Yeah, here it is disappeared, right? You see, if you click this, it will display. Yeah, yeah. Okay. Then last one is 189. Glutamine 189. Okay, sorry, 189. Here 189. Glutamine is yes over. Now all the amino acid I have highlighted. Just you can just close this tree. Okay. Now you see this rainbow color amino acid residues are important amino acid residues. Now what you can do, the box what you are going to set, grid box, you should cover this region. That's all. This is site specific docking. If you don't know this regions, fully cover the box, fully the whole protein should be covered and perform the preliminary, then check where the ligands are going and binding, then perform the second docking. Here it is site specific, highlighted the residues. Now I am going to fix the box in this region. Now what you can do, grid box. Okay, default is grid box. Now we need to fix it inside That is, all rainbow residues should be inside the box. So just you can XYZ coordinates. You can just scroll it, spacing. You can scroll it, and grid box center. All this you can just explore and make it this inside. So just I will scroll it so you can see. Just our ultimate objective is to cover all the residues. Just by experience, you can just scroll and scroll and see whether this amino acid are all inside this box, grid box. Amino acids, everything is inside in the grid box. I think everything is inside. Yes, all covered. This rainbow residues, that is active amino acid residues, all are inside. Once again, you see, sir, you can ask, this only up to here itself, it is okay now, like that you can ask. But see that the box should cover all the rainbow residues, and once again, the grid box should be big enough to accommodate your ligand in its fully stretchable conformation. Okay, that is very important. If your grid box is small and your ligand in fully stretchable conformation, if it is coming outside that, it's of no use. So see that in site specific, your box is fully covering the residues as well as big enough to accommodate the ligand in its fully stretchable conformation. Okay, so I think this is very opt and okay, you can proceed with this. Okay, all the residues are done. Now what you can do is, just once the coordinates are there, now you can just close saving current coordinates. Just close saving current coordinates. Now the coordinates are saved. Now next what you can do, so grid box over, output save GPF. Grid parameter file should be saved. Here the file name I am giving simply grid.gpf. So GPF file is saved in demo folder, not saved. So grid GPF file is created. Now DPF file also we can create. Okay, so for DPF file, macromolecule should be choose. The macromolecule is a rigid file name because we are going to keep it as a rigid. So which is macromolecule here? Protein PDBQT, select, open. Then ligand, you are going to choose which ligand. This is ligand, flexible ligand, so ligand, select. So it's by default you can go with the settings here, accept. Then docking, search parameters, we are going for genetic algorithm. So by default 10 confirmations. Okay, you can by default we can go. So then we can go for output Lamacan. Latest one is Lamacan GFO 4.2. Just output you are going to be doc.dpf. I'm giving the name doc. Okay, docking parameter file. So there grid parameter file. So grid.gpf, here doc.dpf. This is simply save. Over. Now you can just open your demo folder. Now you can see PDBQT files for both. GPF file is there and DPF file is there. Then these three executive files are there, binary files are there. Now we are going to execute auto grid, that is map generations and docking. So this I told you now, traditional Sigwin and all involved difficult. So we are going to do it in Windows itself. So Windows, simply Windows command run. So you can go for CMD command prompt. Okay, command prompt, simply Windows command. So you can see here the destination folder here uses Amanu, that is it is there, but our destination is uses desktop demo. These two things are there. So what you can do, CD commands, cd desktop, enter. Now it is in desktop. Now cd demo space demo. Now it is our destination folder. Okay, destination folder. You can, by using cd commands, you can come to your destination folder. Now what you are going to do, command, autogrid command, simple, autogrid4.exe. This is the executive file which is present in your folder, autogrid exe application file, autogrid4 exe. Then simply space minus p. P is the parameter file which is going to be read by this. So space, what is the parameter file? grid.gpf. So minus p is the parameter file which is going to be read by autogrid4. Then space minus l, that is the log file which is going to be created by autogrid4. Log file, what you want? Space grid.glg you want. Okay, glg is log file. That's all. Autogrid4 exe minus p grid.gpf. This is the file which is going to be read. This is the file which is going to be created. Just enter. Wait for the response. If the cursor is blinking here, the activity is okay. Whatever you have done is okay without any error, and you can just open your demo folder. Now you can see some extra files are created. So glg file 0 KB, that is, it is started to create. It is, the process is running. Then you can see map files. So you can, this field file, XYZ coordinate files, field map files. So whatever autogrid optimization you have done now, so all this started to form, all this started to create. Okay, glg file also, it is 0 now. So it is, the process is not yet completed. So you can wait for the response. Once it is completed, you can just the cursor will be ready for another command to resume. Auto.4. Still it is in process. You can see here glg file is still there, processing. We can wait for the response. So meanwhile it is done now. We need not to be idle. So one thing I will tell you, the protein, the ligand, if you don't have Chem3D to convert into PDB, so what you can do, it's an online program is there. One such thing I will tell you. So ACD is a free software, ACD Sketch. If you are sketching, in ChemSketch, what you can do is, oh, it's being searched. Okay, ChemSketch. Okay, app. This app. So in ChemSketch, you cannot directly save in mole format, right? So in ChemSketch, you cannot save in mole format. You need to export. After sketching, you need to export so that to save in mole format. 1 second, I will just. Yes. Okay, this is ChemSketch. Okay. So simply, if whatever structure, if you are drawing, right, any structure like anything, if you draw something like this, something, whatever you're drawing, you cannot save it. Sorry, you cannot save it. Save as if you give means only in ChemSketch format you can save. So better what you can go, you can file, export is option is there. Na? Export option, if you go means you can save it in mole file. So once you have in mole file, you can just convert it into PDB file, like in online itself. Online Smileys translator. Smileys is another format of chemical atoms. You can see online Smileys Cactus NCI NHI Go. This online web tool, you can it's many tools are there. This is widely giving in the PDB form, which is most optimized, and correct connections will be there when you convert in this. The best based upon experience, the best one to convert in online, you can go with this online Smileys translator. So you can see here input format, unique Smileys output format, what format you need. So your mole file, you can just just go for mole file demo. Just ligand. Where is the ligand? All files, no mole files. Can ligand in SD file. Mole file, right? You can just choose the ligand mole before clicking translate what you want, what format you want. PDB format you need to click, and this cable or aromatic substitution nothing. Then here for PDB you need 3D coordinates. Just to click 3D coordinates and translate. PDB 3 coordinates, user defined exchange format. Now it is ready. Just simply if you click your ligand in PDB, you can get. This is your ligand in PDB format, you will get. It's simple. Okay. Only thing, energy minimization is not there. I told you, no. Autodoc already, it's a flexible 10 confirmations. It will be done. So if you Chem 3D is there, energy minimization can be done, and you can save it in PDB. If it is not there, Chem Sketch is there. Export it into mole format, and you can do it online by with the help of online Smiley's translator, which is a very good platform. So now I think it is completed. Yes, it is completed. So this completion depends upon your computer speed, right? Processor speed, RAM speed, and as well as your ligand size, protein size, or your grid block size. Okay, so you can see demo folder. Grid GLG is finished. Protein maps, all maps have been created, and uh, we can go for a docking command. So now auto doc 4.exe space p, which is with the help of GLG, DPF will be now creating the DLG file. So doc.dpf. So this command will read the parameter file. This parameter can be captured. So this you can publish as a doc to complex. This you can publish as a ligand interaction diagram, and from the notepad you can get the binding energy, or from this itself you can get the binding energy, and you can just this is the native ligand we have done. So you can do with your design ligands, and you can compare the results. So I think I have taken much of time, but since it is a demo session, I cannot omit some of the important things. And I'm very sorry for this, and I hope you understood, and I'm ready for the questions sessions. Sorry and thank you.
Thank you, sir. It was a really informative session for us. We have got few questions. Shall I pose the questions, sir?
Yes, ma'am. With pleasure.
Thank you, sir. The question came: at what resolution should be selected? And protein should be selected from PDB.
Pardon me, madam. Pardon me.
Yeah. At what resolution should we select the protein from PDB?
Yes, in PDB you can see a variety of right. As I had already told, a protein resolution of around 2 to 2.5 Armstrong would be more appropriate, ma'am. More than that also we'll have some graphics disturbance. Below that also we will have some graphic disturbance. So 2 to 2.5, it is more appropriate to select. With that resolution, you can just, if you don't have that 2 to 2.5 and you have 1.9 Armstrong, then you can go for that, no issues. But you will be having from 1 to 3 also, no issues. 2 to 2.5 Armstrong will be good based upon experiences and literatures. Hope I answered the question.
Yeah, thank you, sir. And one of the participants has asked, how can I decide the number of active torsions in my ligand?
Yes, actually, as I already told, torsions, if it is more, if your designed ligand has multiple rotatable bonds, generally active torsions will be more. Okay, active torsions will be more. Autodoc automatically means detects the active torsions. So when it is automatically decided or detects, when you are setting the torsions, it will give you how many torsions are there available. Say, for example, in our cases, it is 7. ADT automatically detected the torsions 7 as a 7. But since our experiences 1 to 6 is optimum, so I have changed it into 6 and we have performed. But 7 also we can you can use. That torsions are nothing but rotatable ones, which determines the flexibility and rigidity of your ligands. This ADT automatically can detect, and while setting the torsions, it will give you how much it has detected. So from that, say for example, your ligand is having 19 torsions. You don't want to work with 19, so you can set fewest atoms, and you can go with 6 or 8 or 7, whatever it is. Up to 32 also you can do in Autodoc, no issues. But see that more flexible, problematic result. It is difficult to find out best pose. Yes, thank you.
Thank you. And one more question, sir.
Yes, ma'am.
What changes does the genetic algorithm and Lamarckian GM makes to the receptor and ligand?
Yeah, so differences if you see means this Lamarckian is involves with more algorithms. See, genetic once again. When you go for basic algorithms, if you see simulated algorithms, it does not have much refinement. Simply, say for example, features, descriptors which are going to run. Say for example, protein is there, ligand is there. Preliminarily, it goes and checks. Say for example, 100 runs you are giving, 100 ligands you are giving. Preliminary, it will go and further fully tight fittings or further refinements, it will not going to give. When you come for higher algorithms like genetic algorithms or Lamarckian, further refinements you can get. Like um, uh, for example, 1,000 molecules you have. From that 1,000, you can make 100 good ones, right? If you go for higher algorithms, means from 100 you can make 10 good ones. You can understand. Making 1,000 from 1,000 or millions to 100, you can go for simulated annealing algorithms, some basic algorithms. So it will just cross check with minimum descriptors. Oh, okay. So say for example, 100 keys you have. The keys which is entering into the lock, first step is in simulated annealing this algorithms and all, whether the key hole is allowing the key to go, the lock hole is allowing the key to go inside or not. That is the first criteria. In that 100 keys, only 10 will enter. Other things will be in opposite posts. It will not even get into inside the lock. So that type of algorithms only preliminary. Then in that 10, which will turn and open the key, maybe 2 or 3. That basic stretches this genetic algorithm, like higher algorithms can be going. Hope
Thank you, sir.
I
We'll take the last question. Citations of docking from this software can be used for publishing. One of the attendees have asked.
Obviously, ma'am. When you go for freely available software, Autodoc is having more publications, widely accepted because of this algorithms, Lamarckian algorithms, and the results. It is highly comparable and very wide publications. Even in higher journals, it is accepted. The thing why we ask this question is we are not able to go into that type of publications. Why? Because simply what we do, A, B, C, D. This is the steps. I did A, B, C, D, and finish. That's all. Finished done. But if it is done like protein downloaded, ligands designed, and docking performed, result something came. This energy I took, this energy I kept, and I'm writing a paper. They rejected. This is something very tricky. Means simply if you do like these steps, it will not get accepted. See, if you download a protein, you need to validate that protein. If you are going in Autodac, it is not like that. Simply you are going to just download and just docking. So you that region section, you need to validate. Some enrichment is required for additional studies is required. Validation protocol, optimization, validation protocols are required. So additional like what to say, RMSD enrichment is required. If you check, go for any higher end journals, Autodoc works will be there. If you download and see, you may have other things which are not discussed here. Here, as a basic thing, which how to perform a docking, how we have discussed. But other than that, like publications, once you the journal communication is there, the questions like what we experience is, where is that optimization? Why? See, in protein data bank for that COVID-19 protease, 17,000 hits are there. Why especially you selected this? You need to have a proper defending answers. Why particularly that? So there are some additional simple exercises are there. So based upon this, based upon docking, RMSD root means square deviation. So once again, that is also plays a major role in docking itself. Since sign consent is there, I much not touch this RMSD. I have given that link is there. So I have my mail ID contact. So anyone has doubts, you can just get into that. So RMSD is once again a distance between the atoms. So once again, after docking, I told confirmation can be changed. The initial confirmation, if it is once again changed, meaningless. So once again, this docking validation should be reported. So if all these things are there, and with that molecular auto docking, molecular dynamics simulation, if it is then 100% higher end journals can accept these papers. We have once again we have many journals based upon the Autodoc platforms. I hope answer this question.
Yeah, thank you, sir. Thanks for your patience clarification. Thank you. Now that session is over to Mr. Shatish.
Hello, sir. Thank you, sir. It was a very useful session. I think participants would have used it for 3 hours, and also you are spending the 3 hours for these participants in the online and in your busy schedule. Thank you very much, sir.
It's a pleasure, sir. It's pleasure. It's just teaching, knowledge sharing does not look the time, sir. Because since I have somehow rushed, time constraint on opposite end, sir. Is if you make it me to sit for the whole day, it's no issue, sir.
Thank you, sir. Now I would like to call Mr. Vijay Kumar, sir, to end the session by giving vote of thanks.
Vijay Kumar, sir, is turn on the audio, sir.
Yes, sir.
Turn on the audio, sir. Vijay Kumar, sir.
Yes, now it's okay. Thank you, Satish. And it's a big lengthy session by Nurula. Thank you, Nurula. Thank you.
Thank you, sir. Thank you. It's a pleasure, sir.
And good afternoon, all of you. It gives us an immense pleasure to give vote of thanks in front of you. I would like to thank our management, our chairman, Mr. Uday Mehta sir, who started yesterday with his presence, and our beloved principal, Professor Dr. Grace Ratnam ma'am, who is behind that webinar and giving a valuable suggestions in the period of conducting webinars. Without her, we can't do anything. And I support, I give an extensive support which given by the webinar team, Dr. Ubaidullah, Dr. Ramlakshmi ma'am, Dr. Kumarvel Rajan sir, Dr. Priyanka Singha, Mr. Satish Kumar and Mr. Sivakumar, who are taken part in a valuable manner to arrange this webinar series from 1 to 4 and going on beyond this also. And I would like to thank all HODs of our college, faculty members who given support and role in participating in the webinar series. I would like to thank the speakers of 2 days webinar series, Mr. K.K. Vishwanath, Mr. Srinivasan Murugesan, Dr. Mohan Kandasamy and Ramasamy, and now K.M. Nurullah sir. Thank you very much for accepting our response immediately with your busy schedule. And I would like to thank all the participants who taken part from different research institutes, different colleges and universities for this webinar series. And also we expect in future webinar series also. Thank you. Thank you. Thank you.